Yeah. Okay. These backgrounds, but the stream. Oh, my mic was on. I didn't notice. Yeah, I did my voice exercise today. I think my voice is gonna be really bad, but hi, welcome to the stream. I'm gonna start the stream now. Just give me a second. Hello, hello, welcome everyone. A second. Sorry for the black screen. We're doing a study stream, so wait, where's my webcam? And webcam thing. Wait, there you go. Nope, nope, nope. Where is it? Okay, there it is. There you go. Okay, okay. I hope nothing's reversed, and I hope we can see that part. Okay. Yep. Okay, let me just put my keyboard aside. And let me just turn off my mouse as well. Okay. Yeah, my mouse pad's pretty much simple. It's just black. It's just completely black. It's you know, it's sort of dust free because it's black. So I don't like need to fucking care of cleaning it regularly. I rarely clean my mouse pad. Let me just adjust the mic is literally in front of the so I can't really see anything. Plus, yeah, the light does well. Okay, I think it's much better now, much clearer, and yeah, I'm pretty sure you guys can see it. So I'm just gonna start off with censoring, but I'm sure yeah, my handwriting is especially bad, and plus, you know, the clarity is really bad as well. I can't really help it, but wait. Let's see. I mean, my stand is broken, so it's really hard to get a good adjustment on it. I don't know how to fix it. I really don't know how to fix it. But I think, yeah, let's do it for now, and tomorrow I'll think of something else. I'll think of an idea. Yeah, my stand, my camera stand is broken. to buy the one, but I don't know. I want to save money. I'm not getting enough to save money. I spent on silly things a few fucking times today. I spent on fries. I spent on chicken loaded fries. Okay, let's and then the previous day I spent on my chair. I got a new chair, a really comfortable chair, which is gonna let us sit for long hours without getting a backache. So it's just my chair. Okay, there we go. So we're gonna start with systemic path, and if time permits today, we'll go to general. But I think systemic path is very big. It's gonna take time. So now we have an onion viral skin appearance, onion skin appearance. This is malignant hepatitis. This is pink. Okay, this is just hyaline membrane. This is hyaline membrane. So this you see in arteriosclerosis or benign hypertension. Onion viral skin and malignant hypertension. Then we have kidneys. This is like flea-bitten kidneys. I don't know how this is flea-bitten, but well, pathologists are pathologists. Flea-bitten kidney, malignant hypertension. Now we have a 35-year diplopia with a vessel biopsy. So patient is 35-year-old female who has he's a male with biopsy. So you see here there are giant cells. So this is the vessel biopsy. There are giant cells. Giant cells occur in only two diseases, which is giant cell arthritis and Takyasu arthritis. Difference is this is 35 years, so less than 50 years, it has to be Takyasu arthritis, and more than 50 years is giant cell arthritis. So now here we go. Giant Takyasu arthritis, giant cells, granuloma, diplopia, blindness, type 4 hypersensitive. Then so granulomas can occur in Takayasu's, early side giant cell arthritis, Wagner's. It's called a GP World Cup. What is World Cup? W is Wagner's, and so it's CSS. I don't know. So now subclavian artery affects the Takayasu arthritis, whereas whereas temporal artery affects giant cell arthritis. So subclavian is Takayasu and giant cell is temporal. So as I said, less than 50 years, hand claudication and pulseless disease. Whereas giant cell is more than 50 years, and you have a jaw claudication usually. Now patient is chronic HBV, hypertension with a vessel biopsy. Now we can see there's a pink fibrinoid necrosis. This is panvasculitis. So if they mention history of hepatitis B, they give a vessel biopsy. It has to be a medium-sized vasculitis or panvasculitis, and most 30% more common. Now, medium-sized vasculitis, what are the other examples? It's Kawasaki's, Berger, Pan. Fibrinoid necrosis occurs in three things: MRP, malignant hypertension, RHD, and panvasculitis. Now we have something called MPA, microscopic polyangiitis. Polyangiitis, it has three P's. One is pulmonary involvement, one is increased P ANCA, and third is drug of choice is penicillin. So three P's, pulmonary for polyangiitis. So polyangiitis has three P's: pulmonary involvement, P ANCA, and penicillin is a drug of choice. Now P ANCA is also positive in Churg-Strauss and eosinophilic granulomas. Churg-Strauss. Okay. So what do we have here? We have a 45-year-old with a hematuria and hemoptysis. They show cavity lesions. Oh, this is the same thing. Okay. They show cavity lesions and there's saddle nose deformity. So this cavity lesion, saddle nose deformity, most common is Wegener's granulomatosis. As I said, Wegener's granulomatosis. You see granulomas. So these are granulomas, and in Wegener's granulomatous, C ANCA is positive, unlike what we saw in microscopic polyangiitis and Churg-Strauss, which is P ANCA positive. In Wegener's, it's C ANCA positive. So there's three C's: cavity lesion, C ANCA positive, and drug of choice is cyclophosphamide. So there is 3P, here it's 3Cs. Now identify infarct in the image. So this, what they use in the heart is the TTC stain, where the viable area is red and the infarct is pale. This is the infarct, pale in color. Now we have reduced cardiac output. Myocardial biopsy shows ninja star nuclei. Ninja star nuclei is seen in dilated cardiomyopathy with titin gene mutation. So ninja star, dilated cardiomyopathy, titin gene mutation. Most common, it's idiopathic. Acquired is in pregnant is peripartum cardiomyopathy, where we call the mnemonic pregnant Mia. Pregnant means peripartum cardiomyopathy. M is myocarditis. I is iron toxicity or idiopathic, and A is alcohol. Pregnant Mia. Now we have boxcar nuclei. Boxcar nuclei is seen in HOCM or hypertrophic obstructive cardiomyopathy, where you have beta myosin heavy chain. So in HOCM we have 3 H. One is HOCM, one H is HOCM, second H is beta myosin heavy chain, and third H is helter-skelter myofiber disarray or banana shaped cavity. So we have 3 H. One is HOCM, second is beta myosin heavy chain, and third H is helter-skelter myofiber disarray. What other feature we saw is they have boxcar nuclei with banana shaped cavity. Simple. And next we have Aschoff nodules. A for Aschoff, A for acute RHD. So acute RHD, there are 3 A's. One is Aschoff nodules, one is Anishkov cells, and the third is acute RHD. Anishkov. Okay, so there's Aschoff nodules. So they gave a picture like this with a lot of nuclei. These are the Aschoff nodules. Then they give a picture like this. It's Anishkov cells. This indicates acute RHD. Now, as we said, acute RHD has 3 A's. Now, chronic RHD has 3 M's. One is fish mouth stenosis with the M, fish mouth stenosis. Second is McCallum plaque, and third is mitral stenosis. So, chronic RHD, it has 3 M's. One is fish mouth stenosis, second is McCallum plaque, and third is mitral stenosis. Now, infective endocarditis, you see large size thrombi, which are most variable and most cause of emboli. Now, small size vegetation, they are the least variable. They're very strong and they're very firm, and they're seen RHDs. Now, medium size is a non-bacterial NBT, thrombotic endocarditis, non-bacterial thrombotic endocarditis. And you see lip shape, Lippmann, it's called Lippmann sac, where it's like a lip pulling out of lip, upper and lower lip. So this you see endocarditis. Lip and endocarditis. Now, endocarditis, there's something else to see. You have tree bug. Wait, never mind. That's not endocarditis. Okay, in syphilis, in tertiary syphilis, you'll have the cardiac involvement, right? So in cardiac involvement, you have a tree bug appearance, treponema aneurysm. So that's 3 T's: tertiary stage, tree bug appearance, and treponema aneurysm. Now, Naxos syndrome, or we have a silly mnemonic, I don't know. It's an actor with the woolly hair, so that's easy to remember. He's like a tiger in acting, and we call it Tigret effect with woolly hair. And he has strong foot. He kicks, and the guy, he just goes flying. So that's hyperkeratosis. So it's so stupid, I know, but it's the only way we can remember. So Tigret effect is nothing but triglycerides, accumulation of fat causing ARVD. Next, arrhythmias. Then we have woolly hair. Then hyperkeratosis also. So the gene involved is plakoglobulin G. So you see plaque, basically hyperkeratosis plaques. So plakoglobulin gene. So this is Naxos syndrome. Next, we have morphological changes in EMMA. Easy to remember. Earliest electron microscope finding is mitochondrial cell. Earliest light microscopic finding is waviness of fibers. Earliest gross finding is dark mottling of the heart, of the myocardium. Now we have different times, 0 to 30 minutes, there's no change in light microscopy, only electron microscopy findings. Now, half an hour to 4 hours, you see waviness of fibers. Now, 4 to 24 hours, you see coagulative necrosis. 1 to 3 days, you see neutrophil infiltration. 3 to 7 days is neutrophil is replaced by macrophages. 7 to 4, that's 3 to 7 days. So now 1 week to 2 weeks, we have granulation tissue. 2 weeks to 2 months, we have fibrosis, and more than 2 months, we have a dense white scar. So if they mention a contraction band necrosis, then that means it has a reperfusion injury. Lymphocytes in myocardium indicates myocarditis with presence of dark blue cells. Also, one day we did say 4 to 24 hours, we did say coagulative necrosis, but you also see mild neutrophilic infiltration as well. Next, we have newborn with respiratory distress. There's so what do you see this pink? Pink is hyaline. This is hyaline. So you see this damaged hyaline here. So this is this space, this clear space. This is hyaline membrane disease. Earliest mechanism is endothelial injury. Leukin involved is IL-8. IL-8 is neutrophils. Type 1 pneumocytes are damaged, and type 2 pneumocytes undergo hyperplasia. So hyaline membrane disease, or ARDS. You have mechanism is by endothelial injury. So pink alveolar surface, presence of IL-8, which increase in IL-8, which is increase in neutrophils. Type 1 pneumocytes are damaged, whereas type 2 pneumocytes undergo hyperplasia. Next, we have COVID, ARDS, HMD, DAD, diffuse alveolar damage, fibrin-rich exudate, and gray hepatization of the lung, which is chronic. Next, we have dyspnea with gelatinous sputum. So we can see this all this pink inside the alveoli. This is nothing. Pink inside the alveoli, or P for pulmonary alveolar proteinosis. So PAP. Pura means complete in Hindi. So pura alveoli pink. So if the entire alveoli is pink, that means PAP, pulmonary alveolar proteinosis. Now, in this you have decreased GM-CSF causing breakdown of surfactant protein. Now, history of smoking with bulle lesions near the pleura. So, depending on where the lesion is, you can in emphysema you can classify it. Now, if it's near the pleura, then that means it's paraseptal emphysema. Paraseptal, P for 4 P's. So one is paraseptal emphysema, one is near the pleura, 2 is near the pleura, 3 is panda-sized cavity, a large-sized cavity, and 4 is if it ruptures because it's near the pleura. It has prone to rupture and causes pneumothorax. Now, if the lesions are present in the center of the lung, it's called the centriacinar emphysema. So again, yeah, you should know where I'm getting at. Centriacinar, or 4 C's. As most common is cigarette smoking, sealing of the lungs or the apex of the lung. Choti in Hindi is small, so small cavity. So that's 4 C's. Now, then we have panacinar present everywhere. So panacinar, the mnemonic is PAN, pan. So P for panacinar, A for alpha-1 antitrypsin, and N for Nietzsche. Nietzsche in Hindi means down, so down, lower lobe. And the other echinine is the N, which is non-alcoholic, non-smoker. So that's 3N, pan 3. So let's revise again. So this paraseptal emphysema. So we have 4 P's: paraseptal, near pleura, panda, or large-sized cavity, pneumothorax after rupture. Now, centriacinar, we have 4 C's. One is centriacinar, second is associated with smoking, then sealing of the lungs, and one is choti, or small cavity. Then we have panacinar, P-A-N. Panacinar, alpha-1 antitrypsin deficiency, then Nietzsche, or lower lobe, non-alcoholic, non-smoker. Now, who do we have here? Smoker, cough sputum for 2 years. So he's having a chronic cough and sputum, which is nothing but chronic bronchitis. Now you see the thickness, so it's call it the Reed's index. So Reed's index is nothing but A by B. A is the my brain's not working here. Okay, it's A by B. A is the thickness of the... What is A by B? I don't know. So normal is 0.4. They won't go into any details. So normal is 0.4, and if bronchitis is there, then 0.5. Small by big. I'm just gonna remember A by B or small by big. Now, sputum examination in 12-year-old with episodic breathlessness. Always, if they mention a child with episodic breathlessness, first you have to think about is asthma, which is more common in that age group. So they give some pictures. This is the Krushman's spirals. Then these are some crystals. These are the charcoal-laden crystals, and there's Crayola bodies. So Krushman spirals, presence of mucus plugs. Mucus plugs is IL-13. IL-8 is neutrophil. IL-13 is mucus. IL-5 is, I think, eosinophils. Let's look into that in the comments soon. Charcoal-laden crystals, which are nothing but pin needle shape. Galectin-10. And Crayola bodies, respiratory epithelial cells. Now, you can remember that's 3 C's, but I already know asthma a lot, so I'm not trying to remember that. Post-pneumonia. Post-pneumonia, you have, look at this, dilated bronchioles. So this is ectatic lung. This is a bronchiectatic lung. Respiratory pneumonia, what the fuck? 3 B's, base of lungs, and bilateral. So post-pneumonia bronchiectasis affects bilaterally. Respiratory pneumonia, post-pneumonia bronchiectasis. Next, we have base of lung. You have multiple dilated bronchi in there. Now we have breathlessness, 10 centimeter fibrotic patch in the lung. Now, first, every time there's a lung disease, a patient comes like this, he may be a 40-year-old male. You have to ask about his occupational history, because now we see coal-laden macrophages. This is nothing but anthracosis. Hi, Hyper. Welcome to the stream. Thank you for the check-in. Check-in 17 times. Congrats. Keep it going. Well, let me reduce the volume a bit. I think it's a bit too loud. Fuck is Spotify. No, I missed yesterday's stream. That's sad. Wait, you were not there yesterday's stream? I feel like you were there. I feel like you checked in. A lot of people checked in yesterday. I can look into it. Let's see. Keita checked in. Bart checked in. Ida checked in. Lady Eva checked in. Eagle checked in. Zach checked in. Okay, you were not there. Clever checked in. You were in deep sleep yesterday. That's sad. Yeah, I do sleep that night. So. But good news, if you look into my schedule and Discord, I'm streaming every day now, including the days for the study streams. Because I'm not really getting much work done without streaming. It's because I get distracted a lot, and I have less than 20 days left for the exam. Wait, how many days again? Oh my god, I need to count. I need to... It's 12th already. 18 days left for the exam. I'm fucking nervous. Okay, let's fucking get to it. Distracted and what? League, NTE. I'm watching Rings of Power series, which is a Lord of the Rings series, which is really good, and it's too distracting. And I'm watching some movies when I feel like watching, and then I have to work on clips and stuff on stream. So yeah, but mainly League. I'm trying not to get distracted. I'm trying. It took me 2 days to finish one subject, and I barely finished it. And these too distracting for boys. For real. I really need that Xancos skin, but I'm spending way too much on games, you know. I'm spending way too much. I buy the BP, I buy the monthly. Then League, I wait for a good battle pass, and there's a really good battle pass coming soon next month, I think. Depends. I don't know if I'll buy that, but you're spending real money. Yeah. Yeah, I'm spending money on stuff like this, and I get allowance once every 2 months. I'm afraid it's gonna run out by the end of 2 months, before the end of 2 months. And then again, I spend on food. I spend on some snacks without having my parents. I mean, they don't need to know what I spend on. So. But yeah, I do waste a lot of money, unfortunately. I just buy new games. I already have Cyberpunk. I bought it 2 years. Caught for a kid. I don't have any new games to buy. I mean, there are a bunch of games which I really want to play, but I don't feel like it's worth buying right now. I'll just wait for some Steam sale on those games. But yeah, I don't think I can buy this next 2 months. I don't think I can buy any game in the next 2 months. Definitely can't buy GTA 6 until the PC release because I don't have a fucking PS5. So I have time for that. I'll get a job by then. You're 24, get a job? What do you think I'm studying for? What do you think I'm studying for? If I get through this, I get a job by December. But I'm planning on doing a small internship type again in an ophthalmic clinic. I don't know. It's my mom's friend. He owns the clinic. Wait, guess your age. I think I already know. I think you told me this before. 23, 21, 23, 21. I don't know. 21 to 23, somewhere between. Wait, I think you finished college because 16. I have been 11th. That's crazy. We have a 16-year-old chat. We have a fucking 16-year-old chat. Mods. I'm joking, dumb man. Good guy. He's a fucking degen. He's a degenerate. He's a 16-year-old degenerate, and it's okay. We're no one sleeping with him. That's you need to put a 16-year-old on your profile, buddy, so that no one accidentally slips into your DMs from my chat. Because there are some horny motherfuckers in here. Okay. Brown macrophages, hemocyanin. Okay, so brown macrophages or hemocyanin-laden macrophages. You usually see them in heart failure cells or hemochromatosis or chronic venous congestion of the lungs. Now, okay, here we go. Yellow, brown, dumbbell-shaped bodies, like golden brown. That's ferruginous bodies. Asbestosis. So he divided into asbestosis base. So there's base and asbestosis. So the base is nothing but lower lung, cement or shipyard industry. You have ferruginous body, and most common cancer associated with asbestosis is adenocarcinoma, but the most specific is mesothelioma, because this is tricky because they mentioned most specific, you have to say mesothelioma. If they say most common, you have to say adenocarcinoma, because mesothelioma is not so common. It's more specific to this asbestosis, but it's not so common. Adenocarcinoma is more common among anyone. 16-year-olds in India, how are they? They are a bunch of degenerates, I swear. I mean, is there as degenerate as a 12-year-old in Russia or in USA or Romania? I'm specifically mentioning Romania because I know how degenerate Romanians are. Hi, Zaki. Welcome to the stream. How are you doing today? So yeah, I'm saying 16-year-old Indians are bad, but not down bad like Americans, or I don't know how it's in Germany, but Russia and USA, 16-year-old is that part where people do drugs, alcohol, sex. Matt, what about you? Yeah, I really got studying today. I was having a really bad episode of dizzy. Like I was being dizzy. I was a bit like pathetic at night. So I wasted the entire morning and the afternoon. Morning was the entire dizzy episode, and afternoon was where I took the meds and slept, and then woke up in the evening. I'm like, I did not get any studying done today. But yeah, I don't think the same stands this like in Gen Z, Gen Alpha generation. I don't think they fucking give a shit about sex or beer in that aspect. I heard a lot of Gen Z kids hate beer. I mean, people who turn 21 at least, they just hate beer. I agree. I hated beer when I first drank it, but it slowly starts to get down and you kind of start liking it. And when you go to a bar, the first thing you order is a beer. Like me and my cousins, every time we go, we order beer or cider, and then we get down the hard liquor. First beer to chill. You are also Gen Z. I'm 2002, and the older part of Gen Z. And the older part of Gen Z is still sort of they have the millennial characteristics. I'd say the most concerning people are the Gen Z close to Gen Alpha. True, you did say you were dizzy. Hope you're doing good now. Yeah, I'm fine. It was just SNRI withdrawal. True. I talked to a psychiatrist way too for a few days, like a month back when I had the same episodes. And they said, yeah, you don't take your medicines for 3 days, that's what's gonna happen. You better take them every day, and I still continue to do that. Sort of a withdrawal effect. Luckily, but no, thank you. Yeah, I'm really good now. I slept way too much, so I think I can really keep the stream on for long today. Okay, so yeah, we finished with ferruginous body, which is nothing but asbestosis. Now, keywords in pneumoconiosis, if they mention tuberculosis or eggshell calcifications, you have to think of silicosis. Never heard you say Hindi or mother tongue, because we don't speak much Hindi here. We don't speak much Hindi in the city. I mean, we do speak Hindi, but it's sort of this Urdu Hindi type, where it's not really a good Hindi. And I'm not really, and plus my university was in another state where they barely spoke Hindi. So yeah. I don't speak much Hindi, but I can speak with any delivery guy or my driver. My driver only knows Hindi. And I do have a driver. Not my driver per se, but my parents and my grandmoms. But yeah, if someone speaks in Hindi, I can try to speak back, but I'm not that good. I'm just gonna say it. I'm not that good. And because of my spending 6 years in another city, in another region, kind of killed my mother tongue and Hindi at the same time. An own driver, it's common in India to have drivers, I think, especially among the doctor community. Who will be rich? Hold it. I'm not that rich. The driver is ready for my grandparents. My grandparents are rich, I agree with that, but it's like my mom pays half and my grandparents pay half, and all he does is sit at home and do nothing. In Germany, it's not common yet. And I'll tell you, one advantage of being in India is having drivers and maids, and they're not that expensive. They're really not that expensive. You can have a 24/7 maid or security, and you don't have to pay much. Yeah, I have a housemate who's in my house for the past 20 years. 25. Ever since I was born, basically. And the driver is for my mom because she can drive, but she has a backache, so she can't drive for long. 35-year-old female, hypercalcemia, weight loss, lung lesions. So hypercalcemia, weight loss, hypercalcemia, 35-year-old female. First, you think about is sarcoidosis. So in sarcoidosis, you have asteroid or stellate bodies, you have Schaumann bodies, you have non-caseating granulomas. So how do you differentiate with the TB? In TB, you have central pig necrosis with a caseating granuloma. I'll make a tour here. Maids are pretty common, yeah. In India, maids are pretty common. They're everywhere. I mean, they're literally begging for jobs at this moment. And a lot of people are quite, a lot of maids I don't like. It's really hard to trust maids these days. They come. We had this issue with the previous maid who used to steal utensils and stuff. Forks, spoons, knives, spoons. It just used to go missing all of a sudden. So it's really hard to trust maids. Either that or they don't do the job properly. They just laze around. You see this dust everywhere, and after they clean it up. And it's kind of hard to clean my house. I mean, for a maid, it's fine, but we can't really put one of those AI vacuum cleaners, the robots, because we have like 2 floors. So that means we need to have 2 robots or something. And there's those bumps between each door, like, stand kind of thing, which I don't think the robot can roam around much. My cousins have that robot. It's pretty useful, but I think only in an apartment, not in an independent house. Ja in Filipino is ha ha ha, no? Ja 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 ja. Or 5555. That's so funny how they laugh. I think it's just, I don't know, is it text or do they actually laugh like that? Paul and me would share the maid. Okay, I have intrusive thoughts incoming. But how are German maids though? Are they good? Like, are they good at the job? Or are they like super expensive? I'm not gonna say it. I'm not gonna say it. You don't have maids that's crazy. But if you say French maid, that reminds me of the Italy skin, the French maid. Holy. I have so many Italy skins, but I never played Italy. I don't know. I struggle with playing Italy. I'm really bad at aiming. So. I think playing in Italy in this elo is just end at this point. No, Latina maids. Yeah, Latina maids are hot. Latina maids and French maids are hot. We could never have a maid like Italy. Oh, that would be wild. That would be so wild if there was. Wait, I need to drink some water. Actually, I did not voice stream today. I before streaming, I warm up my voice every day. I did not do that today, so it's a little rough and coarse. I did not do it well. Well, my warm-up usually involves just singing something in really high pitch and then pursing my lips, blowing through my pursed lips, like, just flappy. Like that. I just stretch my voice so that, I can stream comfortably without having any issue with the voice. Otherwise, it'll be like a mucoid clogging my vocal cords, like not letting me abduct, stretch it out, or adduct, constricting and increasing my pitch. Okay. Intracellular asteroid bodies is in sarcoidosis. Whereas extracellular, when you say extracellular, outside the cell, it's always infective. So that's pyrotrex. Now we have a farmer who has breathlessness and he has fibrotic patches in the lung. So if they specifically mention farmer with a fibrotic patch in lung, which is nothing but giant cell granulomas in the lung, first thing you're gonna think about is farmer lung hypersensitivity pneumonitis. So that includes borreliosis, which is also seen in aircraft or aerospace, or pigeon breeder's lung, and the third is farmer's lung. So that's 3. And they mentioned farmer, so it's still a farmer lung. Farmer lung or hypersensitive pneumonia. Yes. Learn Camille. I was actually thinking of playing Camille today, but I just wanted to see like people playing on this patch first before seeing if she's actually viable now to play on top lane. Because they specifically, like Riot specifically mentioned they're nerfing her for support, but they did not add that many top lane buffs. They just added 1 W buff or something, I don't know. I mean, yeah, they did add some item buffs as well for Bruiser and Eclipse. Wait, does Camille go Eclipse? Because Eclipse was buffed. Black Cleavers was buffed. I don't think Camille goes Black Cleaver, no? What else was buffed? There were a few nerfs. There was that Sundered Sky nerf I was crying on. I mean, it was not technically nerf. They buffed the damage but nerfed the healing. And yeah, I used to use that on Ilaoi and Yorick a lot. Not anymore. Not anymore. That was just when the item was released. But yeah, I'm learning Gwen now. Gwen is kind of fun. I'm 2-0 on Gwen right now. You don't go Eclipse on Camille. I have no idea what you go on Camille. I think Eclipse is for support Camille or something. I don't know. Because I remember playing Camille on support and going Eclipse on her. I don't know. I used to troll on Camille support. Like, barely even played it. I think I played it once or twice on Norms with my cousin. But Stairs got buffed. Yeah, I saw that. Stairs got buffed by 5 damage. It got buffed by like 5 attack damage. But that's pretty good. That's still pretty good. Wait, was it Black Cleaver or Sterax? I don't remember. I think it was Black Cleaver which got upgraded, which had extra 5 damage. Why would Sterax have 5 damage? Wait, what would the Sterax buffs have? 5%. 5%, yeah. Dude. Gwen got massive buffs. Her healing increased by like 11% or something. Gwen has a massive buff on her healing. What the fuck? I played today. It was disgusting. I outscaled the Zahan. I murdered the Zahan. Twice. I murdered 2 Zahans. I think I went 3-0. I don't think it was 2-0. I think it was 3-0 or something. Wait, no. No, it was 2-0. The other time I played against Zahan was as a Mundo. I played a Mundo game and yeah, that was not even close. But again, it was Norms. Norms have a lot of people who are chill, casual. And Cleaver has 5 damage. Well, exactly. Cleaver's got 2 buffs so far, and Yorick is thriving on Cleaver now. Yorick is still thriving on Cleaver. But I always want to have that extra pocket pick because, you know, my Yorick gets bad and... Okay, see, there's 2 things. If my Yorick gets picked, I counter pick it with Yon because I know how to play against Yorick with Yon. But this... I need one pick which I can constantly play like how I play Yorick. So I was thinking of learning like Gwen. Trying to play first strike, and perma-heal, and one-shot everyone. Oh my god, that used to be disgusting, but I don't know. Did they nerf first strike or something that Gwen doesn't go anymore? Because I remember once upon a time Gwen used to do that. A lot of champs used to go first strike, and Gwen used to be one of those. And it used to be a pain in the ass. It used to be just disgusting. Now Gwen just goes Conquer or something. First Strike was nerfed a long time ago. Yeah, I think it was pretty much that just 1 or 2 patches where First Strike was so broken. Even Yorick went First Strike. And I used to go First Strike Yorick with lethality. It was so disgusting. But more for range than melee, I see. And then there was that one range game I played today. It was Gwen versus Jintop. Apparently he didn't know he was picking Jintop and he thought he was going ADC. I don't know what the fuck happened, but I bullied him to death. Me and my jungle just bullied him to death. We did every time his flash shows up, he instantly has to flash because of either me or the jungle. And then yeah, we just tarried him and killed him. It was not even close. Imagine Gen Top, that is stupid. I mean, yeah, he does disgusting early damage, but once he couldn't farm, he literally couldn't farm anymore. It's 50% for melee and 35% for range. Oh. Wait, isn't that more for melee? Shouldn't it be good on Gwen then? Isn't it supposed to be good on Gwen and Yorick? But there was something. Something that made it completely useless on Yorick. I don't remember. I don't even remember what First Strike did anymore because of that. Now we have a non-smoker female weight loss peripheral lung lesion. So this, you see this purple thing? These are the glands. So this is glandular formation. Where do you see glandular formation? You see it in an adenocarcinoma. So adenocarcinoma, IHC marker is brown, tan, TIF1, ALK1, and NOPSIN A. The NOPSIN is the most specific IHC marker, and genes include EAR, E for EGFR, A for ALK1, and R for KRAS. KRAS is the most common mutation for adenocarcinoma lung. Now, there's one more place where you see the same IHC marker, and that's in paraneoplastic syndrome. With non-smoker female, it is a female with one finger less. Imagine they're missing a finger. 50% of the damage you dealt as extra gold on melee and 35% on rage. I don't get it. Why is it not used on Yorick anymore? Because I remember it used to be a fucking gold mine playing as Yorick. But suddenly it just became so useless to play with Yorick. Because I remember once upon a time, not just Yorick, I mean, when like a lot of champs used to just spam First Strike and used to farm free gold. So what were the nerfs exactly? Yeah, I think it was something like 75%. Ah, I see. So really not many champs even go First Strike anymore. I don't even know what champs go First Strike now. Never mind. What do you mean never mind? But it was 100% exactly. Because I don't remember not getting gold out of it. That's what I was gonna say. I was like, 75%. That feels a bit wrong. That feels a little wrong. I feel like I used to get gold every fucking time. Was that just RNG or did I not read properly? Yeah, I think 50% is shit now. Yeah, it makes sense why it's not used anymore. It makes sense why it's shit. But I think Conqueror is pretty decent on Gwen because you get those extended traits and you also get some amount of sustain. I mean, it's still good on Gwen and Chill. Yeah, it's good for one-shot builds for sure. But yeah, I'm looking for some character which has good sustain on the map while doing damage. Something like how I play on Yorick. Because I don't want to go to tank because I'm good at Sam. I'm good at Mundo. There's nothing to be good at. They're fucking tanks. But they don't do damage. They're just tanks. Late game, they're just tanks. Your team is dead. You're just... Either you have to macro win or...
Roll your throat gently down my meat.
And there we come. Hi, Eagle. Welcome to the stream. Thank you for the... There we go. Yeah, that's Eagle's everyday entrance now. Mundo is a bruiser though. I just play him tank. I just go Warmogs into Heartsteel and then I build something like Tornado and then I go for it. What's that? Titanic Hydra. Just for the extra damage. I think there's a really thin line between what's a tank and what's a bruiser. Tanks do as much damage as the bruiser late game. Yeah, exactly. Cruiser is there's a very thin line. There's a very thin line between bruiser and tanks. So this right here. I mean pretty much every time in the league. Pretty much every tank is a bruiser at some point. And Mondays are disgusting. You go Warbox first. You can literally do infinite trade. You just go low on health, go back to your turret and taunt, and then you just wait for 5 seconds, just chill, taunting, do whatever you want. You're back to full health, and you can go and start hitting them again. Monday to 0 max health damage is funny as well. What do you mean 0 max health damage? What the hell? But yeah, I don't want that type of champs where they do little damage, but they have. I want to have, some sort of resistances, but I want to do more damage. So Cyan also I do damage, but in the end he's just a tank. If they don't have Briar, Vayne, Gwen, etc. Cyan is kind of Mundo is kind of stupidly broken. I swear that was the first time I played Mundo in Blue Rift ever, and I murdered the opponent. You get ahead on Mundo, you're unkillable. Yeah, I know that. That's just disgusting. But I lost on Mundo that game. It was my first time playing Mundo, but I lost it because, yeah, they kept targeting their CCs on me. Like the entire enemy team had like a shit ton of CCs, and they kept throwing it at me. I don't know why. But yeah, of course, once one CC is down, the rest CC can hit me, and then I just can't move anymore. But then I just press alt and heal back. But yeah, we still lost that game. We just lost that game. I was just trying to figure out how to play him. I think Mundo is that one champ I can free pick and not be afraid because I don't have any mastery on the champ at all because it's Mundo. Fucking owner played Mundo first time ever on the finals, on a fucking Worlds finals, and murders the opponent team. What the fuck was that? Sadly not blind pickable. I mean, I'll pick him in case. See, so basically, I'm trying to make 2 layers. One is my Yorick, second is something like Gwen. And imagine Gwen is also banned as, I can't go. So the third would be something like, depending on what the opponent goes, I'll either go Yewon or Cyan or Mundo. Cyan would be probably lost because I've really never been on Cyan, even though I get ahead. He's just a fat tank. He's just a body blocking tank. Imagine your Mundo. Yeah. I told you the game I lost, right? The mid pegged Irelia. And the Irelia is so fed. The Irelia is so fucking fed. It's just over. She just went Bork and like the entire team CCs me. Irelia just stomps me down. But Mundo is kind of good against a lot of users. I mean, I suck at Irelia. I suck at playing against Irelia overall. Maybe. I don't play Yorick against Irelia. Yorick is... She just farms my ghouls. When I used to play top and 100% know it's Mundo top, I pick Irelia, make them lose 0-10. Oh my god, you're cruel. But yeah, I can't play Irelia. I suck at Irelia. But my cousin loves to play Irelia. He taught me how to play Irelia, but I just don't stop. I mean, there's nothing but just suck in Irelia, but I don't know. It's just that I usually never play it. She's not too hard. Yeah, she's not too hard, honestly. If you know the game, you can play Irelia, but I just don't feel like playing most of the time. Me and my cousin always have this debate on... He says Irelia is not broken, and I'm like, Irelia is broken. That's because I play tanks. Like her skill ceiling is high AF. Yeah, I used to watch this. What's that Korean Irelia King? Yeah, his name is Irelia King. Oh my god, his Irelia mechanics are just more. Those Irelia mechanics are disgusting. But on a base level and gold plat, she isn't hard. I don't know. I just don't feel like playing Irelia. It's not my kind of champ, you know. Zed, Irelia, Darius, they're not my kind of champ. Even Fira is not really my kind. I don't know. I think I'm a little too domestic because of playing Yorick for too long. That's why I like Gwen. I don't know. Gwen, you can do short tricks. It's up to you. You can go all in. You have a fucking dash. You have a W to dodge. I think coming out of the Yorick OTP, I think Gwen is a really good champ to play. her. I don't really enjoy her that much as well. I like high damage, hyper carry skills. Don't get me wrong. I really is high damage, but yeah, just painful. It's painful. You miss all your skill shots. You still auto attack people to death. Oh, fucking I really am. Bit skills so like. I was thinking set, but set is again. I don't really like playing set. That I tried Olaf today. I intel on him twice. I fucking intel him. I don't know how. All I have to do is run them down, and I still managed to end.
Don't put Furbies in your butt. Don't put Furbies
Put
in your
Furbies.
butt. I told
What's
you
Furbies?
once and twice before, your butt is not a Furby door.
The fuck is Furbies? I heard it as furries till I had to hear it again. With good skill feeling like action. Yeah. I'm not taking ranged top laners. I'm never gonna play ranged top laners. Teemo is for ARAM use only. Teemo is fucking ARAM use only. Furbies are demon spawn. Oh my god. I never heard no one ever told me Furbies ever. I know furries, really. Yeah. That's just why I'll look into it later. But yeah, I was supposed to follow someone. Chotomate. Who was that one who raided me? But I promised them I'd follow them and I forgot to follow them. Now I feel bad. Where the fuck is it? It's not showing anymore. What the fuck? What the fuck? Wait, he did raid me yesterday. Okay, there you go. Bought policy paid. There you go. Let me just give him a quick follow. There we go. Done. Yeah, the one who raided me yesterday. Because when you fall behind an auction, it's over. I mean, even Varus, it depends. If you're going lethality Varus and you fall behind, you don't do anything. You don't do any more damage. On hit, yeah, on hit you're good, but lethality you just fall off if you don't snowball. You know what? You should go? No top. It's just easy. It's over. It's really not hard to play on. But Nunu is just better on mid because you can roam bot. You can just roam anywhere in the map. I think Nunu top is just painful. No top, you can only roam mid and open jungle. Until a bit after 6 and first item. I'm not going range top. I fucking don't want to play Kale top. I just don't like range tops. I bully range top players. Why would I fucking play range top? I mean, I have nothing against Kale. I like Kale, but I just don't want to play range top. I treat Kale as a top laner, and Kale is a top laner, but every other range top is not a top laner. Also, I was looking at current meta win rates in OPGG, and why does Sage have such a high win rate? It's so disgusting. What did Riot buffs censure something that he has such a high win rate? This is win. I meant Singed. Because Singed has a really high win rate, and I'm never gonna play him because I hate fucking Singed and Singed players. No offense against X-Plague. I like him for his Malphite. I like him for his Shamrock Malphite. Okay, yeah, where we continue, we're still in long. Smoker, weight loss, confusion, delirium. So patient is a smoker, he has weight loss, he has confusion, he has delirium. Interesting. So that means okay, now they gave the okay, so they gave sister pathology. Here you see these small dark blue cells. This is called salt and pepper chromatin. Salt and pepper chromatin you see in small cell lung carcinoma and small cell lung carcinoma. So why do they have delirium confusion? That's because of electrolyte imbalance. Patients they usually have hyponatremia because associated SIADH. syndrome of inappropriate ADN secretion. So what do you see in small cell lung carcinoma? You see small dark blue cells, salt and pepper chromatin, synaptophysin or homogranulins. You have SIADH, they're specific for smoking. So these are SS, there are multiple S's. So let's count the S's. Small cell cancer is 1, small dark blue cells is 2, salt and pepper chromatin is 3, synaptophysin chromogranin. 5 is SIADH, 6 is specific for smoking, 7 is severe because it metastasizes to the brain. 8 is sensitive to radio iodine therapy. So that's 8S. All that I'm gonna remember. But yeah, I can remember most of it because it's neuroendocrine syndrome tumor. But since they started using their brains more, I guess. Interesting. Oh my god, imagine since players using their fucking brain. All that is there in Singe players' heads is proxy. Flip the enemy top laner onto their poison and try to make your enemy chase your poison. That's it. That's all that goes in their head, I swear. They don't even look at their top. They don't even look at their opponent jungle. They only try to track their opponent jungle. They go proxy. They make sure that jungle cannot kill them. Hi, Godo. Welcome to the stream. Okay, now we told the 8S, which is small dark blue cells, small dark chromatins, synaptophysin or chromogranin, SIADH, specific for smoking, severe metastatic brain, sensitive radioiodine therapy. It has something called the azopardi effect. So small cell carcinoma has the azopardi effect, and gene involved as LMYC. L is for lung and MYC amplification, LMYC gene. Now, if they say CYMYC, then it's Burkitt, and if they say NMYC, N is for neuroblastoma, and L is for lung, small cell carcinoma. Now we have hypercalcemia, weight loss, smoker. This sounds really similar to the previous one, right? Yeah, sarcoidosis. So this looks really similar to sarcoidosis. But here in sarcoidosis, you don't mention about smoking. Here you mention about smoker. Sarcoidosis is usually present in middle-aged females, but here it's present more common in males. And smoker, weight loss, hypercalcemia. So what you should think about is squamous cell carcinoma. Now we look at the histopathology. You see these keratin pearls. I know everything looks pink and blue to you guys. It does to me as well, but I'm just trying to figure out everything. I don't know, just figuring it out. In the end, I know I'm gonna fuck it up in the exam, but I mean, pathology is pretty much blue and pink. You can have spectral as well. Spectral hates pathology. Keratin pearls. Squamous cell carcinoma has 5 P's and 5 C's. So 5 P's includes P53, P40, P63 IHC markers, and so P53 mutation, P40, P63 IHC markers, Pancoast tumor, and pink keratin pearls. Next, we have 5 C's. C is for central, C for cigarette smoking, C is for cavitation, C is for calcium, C is for cholesterol. I think you're gonna still stream. Okay, good luck on your stream. Presence of the cholesterol is what called the golden phenomenon. I don't really mind range top except for like Varus and Rain. I just don't like it. It's just top laner mentality. No top lane really likes people playing range on top lane. It's not about it's hard or easy. It's about being a top laner. We have our own dignity. We have something called the top lane dignity, and we want to maintain it. We want to maintain that gentleman aura of a top lane, and range top laners are just ruining it. It does not feel like top lane when you play range top lane. I think every top lane says the same thing. I used to be a top lane myself, and I play range on melee on top. Yeah, at some point, top lane. No, range is illegal. You're not supposed to play range. Top lane range are illegal. I swear. I mean, I think if you play range, you would also notice at least every few matches that the opponent or was just gonna yap on why the fuck did you pick top range. Just got Shogat and Manchu. But Shogat is on my permanent ban list. Shogat is on my permanent ban list. It's not like I suck at playing against Shogat, but it's just boring to play against Shogat because I can't really use my Maiden on Yorick unless I have a good setup to use Maiden, because Shogat would just eat my Maiden. So I have to be really careful on when to use my Maiden if I'm playing against Shogat. I don't want that. Everyone who gets fucked by... I told you, it's not about getting fucked or fucking them, so... It's just that it's illness. It's something like, we call it the top lane illness. Playing range top. They're just ill players, and people who purely play range top, they're just ill. As we say, their parents never loved them. EU has Kane top. But yeah, I kind of like Kane top. I used to play Kane top once before a time, but that was just norms. It was just a norms. Just go red Kane top. Oh my god, this would be pure golden. And then Kane had some nerves, and then I was sad. I like Kane, but I just suck at him, I guess. Purple Kane? What the fuck is Purple Kane? What the fuck is Purple Kane? I don't play Kane for his how good he is. I play Kane for his aesthetics. I just love Kane's aesthetics. Holy, his body design is amazing. His skins are so good. I just love that Kane. I just love Kane as a, the character. And he looks so fucking edgy. He's so edgy. When you pick one rune and have to go a different Kane. Oh, base Kane, okay. And light red, I think most top lane Kane players would say red. Then obviously depends if someone's just going some squishy, you just go blue. If the opponent has too many squishies, you just go blue. But red Kane is based. Red Kane is so based. Yeah, I think base Kane is called Grey Kane, no? Or just Kane. It's just called Kane. Or just call him base Kane. I never heard purple. This is the first time I'm actually hearing purple Kane. So CN is tubular with squamous cells, presence of keratin pearls is craniopharyngioma. In lungs, if you see keratin pearls, it's squamous cell carcinoma, but in brain, if you see keratin pearls, it's craniopharyngioma. Purple plus blue plus red is equals to purple. I'm colorblind. I'm joking, I'm not colorblind. That reminds me of that game. Was that movie? It's like cut the wire, which wire? I don't remember the meme. I don't remember the meme. There's light gray, there's medium gray, there's dark gray. It's red, blue, green. And then wait, I'm coming to you. And I was like, oh, I forgot I'm colorblind. Then he's like, cut the left wire. And I'm like, which one is left? And he's like, oh, I forgot. I'm also dyslexic. Purple. So blue ring's going red with purple red. What the fuck? Oh, hell no. I remember Kara's my fighting T1 and winning. I remember Canyon Kane, that was so broken, that was so giga broken. Canyon Kane in 2021, 2020. Holy, Canyon Kane and Lisa is like is fucking legendary. He's a legend. Smell your later or something. Let's see you think. Bye-bye. Good luck on your stream, though. I don't know when I'm gonna end this stream because I slept a lot today. Where were we? Okay, there's smoker, weight loss, industrial worker, worked in cement industry. So we always said cement industry, always say first asbestosis. And they also mentioned smoker. And what did I say? Specific for asbestosis is malignant mesothelioma. So it's impossible to tell in this diagram, but there's spindles and glands. So it's a biphasic tumor. It has both glands and stroma. Stroma is in the form of spindles and glands as epithelium. Now, I had C markers calretinin, EM, multiple. So malignant mesothelioma, there's two M's. That means multiple microvilli or desmosomes are present. Oh my god. So MM, there are two M's. That means a biphasic epithelial and spindle. Epithelial is glands and spindle is stroma. Now we have neuroendocrine tumors, which we talked about already. We talked about small cell carcinoma. And all neuroendocrine tumors are salt and pepper chromatin. And examples are, we call it small CM, large PM, small chief minister, large prime minister. So small is for small cell lung carcinoma, C is for carcinoid tumor, M is for medullary carcinoma thyroid, L is for large cell cancer of the lungs, P is pheochromocytoma, and M is Merkel cell carcinoma of the skin. Now, pheochromocytoma, you see Zell-Balin pattern. It's an adrenal mass associated with men 2A, 2B. It has something called a rule of 10, 10% bilateral, 10% children, 10% malignant, and 10% extrarenal, which is obsolete now, but they still ask for no reason. New research completely changed this 10% rule of 10. So, as I already said, every neuroendocrine tumor has salt and pepper chromatin and is positive for synaptopathy and chromoglobin. Next, so we are in GIT now. So what you're looking at is the gut. So there's the stomach with the cribriform appearance. This is nothing but Meniere's disease with TGF-alpha, increase in TGF-alpha. And how do you remember? Alpha men. Alpha men. Men for Meniere's disease. Alpha for TGF-alpha. Oh my god, my pathology professor is a giga chat. He's a giga chat. He has some really good mnemonics. He's that alpha man. Okay, I'm joking. I'm not gooning over him at all. Totally gooning over him. Okay, so next we have, what is this? There's no way I'm gonna remember this. Cerebriform nucleus, Cesari cells, mycosis fungoides, portrait microabscess. What the fuck? Psoriasis, I don't know. Now we have concentric rings. Concentric ring is nothing but, which we already discussed in surgery, feline esophagitis, or eosinophilic esophagitis. So when I say eosinophil, I already told you before, IL-5. IL-5 is eosinophil, fifth letter. So so we said IL-5. So how to diagnose is this should be at least 15. So 5 for 15. 15 eosinophils per high power field is a diagnostic criteria. Now identify organism and stain. What the fuck is this? So it's all black. So you see these rod-shaped bacilli here. These are the rod-shaped bacilli. This is Helicobacter pylori. So this is the stomach. And the stain for Helicobacter pylori is Wharton-Silver-Stary stain. Purple yellow pigment. Okay. Next, we have a patient with diarrhea, duodenal biopsy, treatment, malignancy arising. So you see this flattening of villi here. So atrophic villas. What the fuck is this? This is just celiac disease. It's just celiac disease. So they said duodenal biopsy. They said so they're not gonna mention just this. They're gonna mention other things like oral are positive, as we already discussed before in medicine. Yeah, so proximal disease, what we said celiac sprue, and distal disease is tropical sprue. So this here we are talking about, they said duodenal biopsy, so it's celiac disease. So most specific, most sensitive is anti-TTG, or others are gliadin, endomycel, and yeah, we said get anti-TTG, gliadin, endomycel. So how do you diagnose? You need a biopsy plus one of the antibodies has to be positive. What all HLA are positive for this? HLA DQ2 and DQ8. Now, what's the treatment? So basically, so you see CD8 and T lymphocytes in the histology diagram. You see treatment is gluten-free diet and something called bro. So you should not eat bro. You should not eat your eyebrows. I'm joking. You should not eat bro. It's mnemonic. It's a mnemonic. It's wheat. I don't know what's it called. I don't know. I'll look into it later. I'll just look into it later. Malignancy associated is T-cell lymphoma, because we said CD8 T lymphocytes are positive. And skin changes is dermatitis herpetiformis. Now we have a patient with steatorrhea. Duodenal biopsy was taken, and you see acanthocytes. So you're talking about the gut with presence of acanthocytes. It's A-beta lipoproteinemia. Where does it say acanthocytes? Alcoholic liver disease, you say acanthocytes. There's one more I can't remember. You see acanthocytes. Okay, it's mentioned here in heart disease, ARVD. Yeah. Okay, in ARVD, you see acanthocytes. You see in alcoholic liver disease, you see acanthocytes and A-beta lipoproteinemia. There's in brain also, there's this acanthocytes, I think. I don't know where do you see that. I forgot. And have you have joint pain, steatorrhea, and you do a duodenal biopsy. So they give steatorrhea. Everything is normal. Everything is normal, but villi is normal. But the patient has joint pain, steatorrhea, and the duodenal biopsy. That is nothing but Whipple's disease. So Whipple's are 2 P's. That means PAS positive pink macrophages. So what's the clinical features? There's a triad of DAD, dementia, arthralgia, diarrhea. So the patient has dementia, the patient has arthralgia, joint pain, the patient has diarrhea. It is Whipple's disease. The structure, histopath should be normal to say it's Whipple's disease. Now next, we have megaloblastic anemia, abdominal pain, and ileal biopsy was taken. So you see here there's non-cacheating granuloma with megaloblastic. That means that it is specifically saying with megaloblastic anemia, there's deficient B12 absorption in the ileum. So there's something wrong with the ileum. So what could be wrong with the ileum? There are 2 things that could be wrong with the ileum. One is Crohn's disease, one is ulcerative colitis. So how do you differentiate them? Crohn's disease, you can say it has 3 C's. One is canker-sore or after-sore, which is the earliest lesions, and it has creeping fat and cobblestone appearance. Now, ulcerative colitis, you have P and K positive, ulcerative colitis and Wegener's granulomatosis and Sjögren's, you have P and K positive, remember that. Then you have pseudopolyps, and also you have pulmonary sclerosing cholangitis, PSC, also you have P and K positive. So the only way to differentiate between these 2 is you take an histopath, or you open up the bowel and it's affected. You're gonna notice the differences. Crohn's will have cobblestone, ulcerative colitis will have. Or you can just do a colonoscope and look into the changes. Next, we have history of malabsorption. So patient has history of malabsorption. Imagine they also mention something like HIV or that immunosuppressed. You see blue round body. You see the surface has some blue round bodies. This is nothing but cryptosporidium, which is strongly associated with Xavier immunosuppression, which I already told. Now, they mention something like falling leaf motility, or they give a picture of like falling leaves. This is nothing but Giardia. Now, patient 5-year-old child, bleeding per rectum. Okay, so first thing, bleeding per rectum, you're going to think colon carcinoma, but now you say it's a 5-year-old child. Can colon CA appear in a 5-year-old child? So this is called juvenile polyp syndrome, or JPS. How do you remember? A 5-year-old child, they learn how to say 1, 2, 3, 4, 5, 6. So how do you remember? 1 is nothing but single lesion. 2 is nothing but SMAT2 or SMAT4 gene, size less than 3 centimeters. We always said SMAT2 4, so that comes there. And child of 5 years, and cystically 6 is for 6 or 6. See how it rhymes? 6 or cystically dilated glands. So patient, they mentioned 5-year-old child with bleeding per rectum. You're gonna say juvenile polyp syndrome. So why juvenile polyp syndrome? They say it's a child. It's a 5-year-old child. He learns to say 1, 2, 3, 4, 5, 6. 1 is single. 2 is SMAT2. 3 is size less than 3. 4 is SMAT4. 5 is 5 years, and 6 is cystically dilated glands. Now we have a 11-year-old child with thumb hyperpigmentation. So he has perioral melanosis. This is perioral melanosis, and there's one specific syndrome associated with perioral melanosis, and that is PJS, Peutz-Jeghers syndrome. So Peutz-Jeghers syndrome gene affected STK11, affects mainly the jejunum. So it's basically stays in PJS, P for perioral melanosis, J for jejunum, S for STK11. Now we have a very characterizing arborizing or Christmas tree pattern. So there are multiple Christmas trees in pathology. One Christmas disease, which is nothing but hemophilia B. There's Christmas cataract, which is seen in myotonic dystrophy with CTG repeats, and Christmas tree pattern or arborizing pattern is PJS. STK11, okay. Is I remember it as T1, SKT1, so STK11, SKT1. So the STK11, that's how I remember it. Easy to remember, actually. 50-year-old bleeding per rectum. So what did I say? There's 50-year-old bleeding per rectum. So you have to do a colonoscopy, because likely could be colon cancer. Straight up, it could be colon cancer. But you can't just say it's colon cancer. You have to see the fucking histology slide. So now we say that the well-formed glands, regular well-formed glands with no irregularities whatsoever. It's well-shaped, well-formed. Then it is tubular adenoma. Now we have a 50-year-old bleeding PR with, giant villus-like. This is nothing but villus adenoma. Now we have 50-year-old bleeding PR with both tubular appearance and villus. So see, you have tubular appearance and this villus pattern. This is tubular villus adenoma. Now we have gastric bleeding. 60-year-old with gastric bleeding. Oh my god, this gastric bleeding. Now let's look at the histology. So there are empty spaces of vacuoles. This is likely GIST, which is gastrointestinal stromal tumor. So originating is the interstitial cells of Kagel. Most common site is gastric mucosa, associated with Carney's triad. Carney's triad is, we already read before, is Carney's triad. One second. GIST, paraganglioma, pulmonary chondroma, and associated with extreme sporadic disease. So we call it GPS, GIST, paraganglioma, pulmonary chondroma, and S is for sporadic, associated with the X gene. So there's something called Carney's complex. So it's not Carney's triad, it's called Carney's complex, which is nothing but myxoma with lipidic cells. So this is seen in heart with Carney's complex. Now, so GIST triad, gastric intestinal SDH gene. Most common mesenchymal tumor GIT is IHC is DOG1. Immunohistochemistry marker is DOG1. Now we have something called Gardner syndrome. Gardner syndrome is cyst in skin plus osteum of the mandible plus polyp in the intestine with more than 100 polyps in the intestine plus desmoid tumor. So imagine a gardener. He has cysts and just imagine, just need to picture a gardener. We call it Gardner syndrome, but it's easier to remember it as a gardener. He's a gardener. He does a lot of hard work. He has cysts in his skin. Now he has a gigachad jaw. He has an osteoma in the jaw. He has a rock hard jaw. Osteoma in the jaw. He has multiple. He grows a lot of polyps. He grows a lot of what is polyps? It's like he grows a lot of plants with flowers. He grows a lot of polyps in his intestines, and he has a desmoid tumor of the skin. So if they mention a garden polyp, then it's COPD. Not Turcotte syndrome or Farmer's-Land. We did talk about Farmer's-Land. Okay, now Turcotte syndrome. In Turcotte syndrome, more than 100 polyps plus medulloblastoma. If they mention, so how do I remember this? Turcotte, turban. Turban is the head. So So in Gardner syndrome and Turcotte syndrome and Little syndrome, remember we talked about this. There's hypertension. There is hypertension. They have to mention hypertension. There's also hyponatremia, I think, in Gardner's. So in Turcotte syndrome, there's hyponatremia. There's cerebral salt wasting. Remember, we talked about this. So Turcotte syndrome, we have in the gut more than 100 polyps. In CNS tumor, you have medulloblastoma, you have hyponatremia, you have cerebral salt wasting. Now, sequence of the gene in colon. Now we're gonna go to colon cancer. Colon cancer sequence of gene AK53, APC KRAS P53. Now, tumor marker is CEA and IHC marker is CDX2. Most common site for metastasis is the liver. So three C's, colon, CA, and CDX2. Now, so there's a patient with hepatitis C infection, single cell dog pink cytoplasm. What is this? Councilman. Okay, it's councilman bodies, apoptotic bodies. So there's nothing but acute hepatitis C. That does not make sense. Okay, they're gonna ask something like, "What are these?" They're gonna option this body, that body. So it's gonna count the body. They mentioned hepatitis C, C for hepatitis C, C for consonant bodies. Now hepatitis B infection. Kikoidal cells. Kikoidal cells and round-glass appearance, 25 hepatocytes, HbA1c surface antigen positive. That we have an alcoholic patient. Identify the pointed structure. So this is nothing but the Mallory dent body seen in alcoholic liver disease. Pink cytoplasmic rod-shaped inclusion made of intermediate filament, cytokeratin 8/18. Now we have something called the Micheli's-Gutman body or malakoplakia. Cystitis, E. coli is the most common cause. So it's nothing but basophilic, royal-shaped cystic inclusion. Micheli's-Gutman body. Mallory dent body seen in alcohol liver disease. Now we have a patient with respiratory difficulty with hepatitis. And alpha-1 antitrypsin positive. So patient has a lung lesion. He has hepatitis. He has respiratory difficulty. What are we gonna think of? Alpha-1 antitrypsin positive. Sorry, wait 1 second. Hold it. Yeah, I did not think it through. Oh, this chair is too comfortable for me. I slept on it. Dozed off on it so many fucking times since yesterday. Yes, I need to go to the washroom. I'll be back in a minute. Give me a minute. Hey, what's done? Welcome back from the ads, guys. Back some true as well. Okay, it's almost 12. Let's see how much you can read here in an hour. Let's see. So we have around 1 to 2 hours, I think. We have 1 to 2 hours. We can do this. So it's been almost 2 hours since it's been 2 hours since we started streaming. What the fuck? It's been 1.5 hours. Okay, good. Does not feel like it. I mean, we didn't cover much, did we? Okay, we did. We actually did. See, I like Path because of this. It's readable. It's fucking readable. Everything looks pink and blue, but I like the reading part of it. I don't like the histology aspect, but I like the reading part of it. So now we have a patient with respiratory difficulty and hepatitis. So both the lungs and the liver is affected. So we see this pink inclusion bodies. There's nothing but past positive inclusion in the hepatocytes. This is nothing but alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency, you see misfolded alpha-1 antitrypsin. What all is it associated with? Panacinar and what's that? Your lobe? I don't know. So bronze discoloration. Bronze discoloration, it's always hemochromatosis. Diagnosis gene involved. You use stain as Persian blue stain. Diagnosis, you already said hemochromatosis. Gene involved is the HFE gene. HFE gene, chromosome 6p, and decreased hepcidin. So it's decreased hepcidin. Now, we have tremors with liver cirrhosis. Parkinson-like tremor. Diagnosis is nothing but Wilson's disease. So, rhodonine is what do you see in Wilson's stain? Rhodamine is in tuberculosis. So more than 200 mcg of liver copper biopsy is the most diagnostic choice. But serum ceruloplasmin level is screening. So ATP 76 or chromosome 32. Now we have a patient, ulcerative colitis patient with jaundice. So what did we say? ANCA is present in ulcerative colitis, is also present in primary sclerosing cholangitis. So the patient is going to have onion skin fibrosis, whereas onion skin fibrosis of the vessel is nothing but malignant hypertension. Well, PBC versus PSC. PBC affects in middle-aged females, whereas PSC occurs in young males. Now, PBC, involvement of the intrahepatic ducts only, whereas PSC, intra plus extrahepatic duct, because SC, sclerosing cholangitis, that is involvement of the cystic duct. So that's extrahepatic ducts. Associated with Sjogren. PBC associated with Sjogren syndrome, whereas PSC associated with ulcerative colitis. Oh my god, my foot's it hurts. My feet like my foot's splitting in half. Oh my god, this fucking hurts. Good chat, give me a second. Sparkles, give me a fucking second. It hurts. It hurts. Okay. Okay, I can't lift my foot off the floor right now, otherwise it just starts splitting apart. Oh my god, that hurts. Okay, we have a John patient with a John. PBC, you see non-Cajun glandular antibody associated as AMA. Okay, now we have a patient with plasma cell infiltrate. Usually it's a young female. You're gonna say, not young exactly, 20 to 30. So it's autoimmune hepatitis. There's of two types, type 1 and type 2. Type 1 is middle-aged female with anti-SMA antibodies, smooth muscle at 10. Type 2 is seen in children with anti-LKM1 antibody, liver, kidney, microsomal. So how I remember is type 1 is 1 for female and SMA antibody. Shake my head. So what do you see? This is cell and cell appearance and polypolysis. Now we are entering kidneys. Very important. So there's subepithelial deposits, there's intramembranous, there's subendothelial, and this is mesangial. So based on the deposits, you can tell which disease it is. So if this is subepithelial disease, there's M or P. So examples of subepithelial deposits are MRP. MG-pathy, R is for RPGN, and P is for PSGN. MG-pathy and RPGN you see in adults, whereas PSGN you see in children. Now intramembranous is nothing but MPGN type 2, membrane filtering glomerulus is type 2. And subendothelial is nothing but MPGN type 1. So 2 comes before 1. And then mesangial is HSP in children and IgA nephropathy in adults. IgA nephropathy in adults is also called Burgess disease. Heteroscrollene purpura. Now let's go to PSGN. So a 5-year-old. Okay, so listen carefully. It's a 5-year-old child of hematuria 2 weeks after respiratory infection. Now they give the electron microscopy with, what is this? This is subepithelial subepithelial deposits. So what did we say? Subepithelial deposits are 3, MRP. M is angiopathy and RPGN, but these are seen in adults, whereas PSGN is seen in children. So usually they mention after respiratory tract. If they mention after respiratory tract for children, it always goes. You don't have to look at the electron microscope. You can just say PSGN. So you see starry sky pattern and ASO antibody, anti-DNase antibodies. Now, patient has hematuria. It shows tram track appearance. What is the diagnosis? Tram track appearance is seen in MPGN type 2 or dense deposit disease. So it's going to be dark basement membrane. So you see there intramembrane. You see this is the glomerular. This is a membrane. This is the fucking membrane. It's so big. So there's intramembranous deposits. Intramembranous deposits is only one disease. We talked about this. MPGN type 2 or dense deposit disease. Next, we have hematuria and azotemia and urea. So azotemia and urea was the differential diagnosis. So we can look at this. The entire basement membrane is ruptured. There's crescent shape. So crescent formation, entire basement membrane is ruptured. That can be only one thing. Rapid proliferative glomerular nephritis, one of the dangerous ones. Now, next we have hemoptysis and hemoptyria. Is a child. They will mention. Wait, no, it's good past a child. It's it's RPGN. Never mind. It's an adult. It's present in adult. So, give me a second, guys. I need to recollect a bit. So there's hemoptysis and hematuria. Usually seen in Goodpasture syndrome. How we remember? Good child. 1, 2, 3, 4. 1 is type 1 RPGN, 2 is type 2 hypersensitive reaction, which is anti-GBM antibodies, 3 is alpha chain, and 4 is type 4 collagen. So recall with me, Goodpasture syndrome, you see hemoptysis and hematuria. You see, this is like completely green. This is linear pattern, which is seen as good for green. So G, good. Goodpasture syndrome, green. How we remember? Good child says 1, 2, 3, 4. Same as how we said in 1, 2 is 6. 1, 2, 3, 4, 5, 6. And PJS. Wait, was it PJS? It was something. It was juvenile. All pluses, no? Now, here you have 1, 2, 3, 4. 1 is type 1 RPGN. However, I say child here, it's seen in adults. Type 1 RPGN, anti-GBM antibodies, which is a type 2 hypersensitive reaction, alpha 3 chain, and type 4 collagen. Next, we have a 15-year-old with arthralgia, hematuria, and urea after pharyngitis. So we said, what did we say? We said after, so it's a 15-year-old here. It's a 15-year-old with arthralgia after pharyngitis. Interesting. So let's look at the microscopy. There is, look at this. This is mesangial proliferation. What did I say? There's two in mesangial. One is HSP and one is IgA nephropathy. HSP in children and IgA nephropathy in adults. So we are talking about a child here. We're talking about a 15-year-old kid. And what is mesangial proliferation HSP? A 15-year-old is HSP. So HSP are IgA positive. Usually how we remember it is a mnemonic HSPA. H is for hematuria, S is for small children, self-resolving, and you treat with steroids. P is purpura, palpable on extensor surfaces, most common buttocks. Platelets are normal. A is IgA positive, arthralgia, abdominal pain. So that's HSPA. Now, so patient has hematuria. What the fuck is this? We already trapped Luxembourg. We already went through this, no? Okay, and the same thing. This is the same thing, just a different diagram. Where you see a double basement membrane because there's intramembranous deposit. So that's nothing but MPG in type 2 with tram track appearance. So why do you call it tram track appearance? Because the basement membrane appears as two different layers when it's supposed to be a single layer. That's because of the deposits inside the membrane. Now we have a nephrotic syndrome patient with HIV. So most common kidney disease associated with HIV and nephrotic syndrome is nothing but FSGS. So FSGS, you'll see a focal pain fibrosis. Now, keywords: nephrotic, history of malignancy, elderly male. So do you see mesangial proliferation here? Wait, no. I just confused myself. It's not, the diagram is not really clear. The diagram is not really clear at all. So M for malignancy, M for MG-pati. MG-pati. How I remember pati is nothing but husband in male, husband in Hindi. So MG-pati and malignancy, MG-pati. So they're gonna say elderly male. It's gonna be a male malignancy, MG-pati. Most common in hepatitis B and HIV. So there's going to be increased basement membrane thickness. You already said it's a subepithelial deposit. Malignant membranous thickness. G is for IgG, MG. P is for PLA2 receptor. A is for adults. TH is for thrombosis. And Y is for spike endome appearance. So Y is nothing but, spike shaped spike endome appearance. So that's a mnemonic for MG-pati. M. What did we say? M is malignant and increased basement membrane thickness. G is IgG positive. P is PLA2 receptor positive. A is adults and TH is thrombosis. And Y is spike endome appearance. So you're going to have non-selective proteinuria, small and large size proteins. Next, we have keywords: nephrotic, 4-year-old, no change in light microscopy. So he's a child. He's a nephrotic syndrome, and there's no change in light microscopy. If they say no change in light microscopy, there's going to be only one thing. It's minimal change disease. So minimal change disease, the only thing you see in electron microscopy is flattening of podocytes. There's going to be, again, selective proteinuria. He's going to be steroid sensitive. Associated with hyperlipidemia, lipid form cells with the glomerulus, aka lipid nephrosis. Now, cotton wool spots of retina. Cotton wool spots on and retina is seen in diabetic retinopathy. So, pink nodular fibrosis at periphery. So there are two. So you see Kinnelstein-Wilson disease, nodular glomerulosclerosis, and Armani-Epstein cells in diabetic nephropathy. Now we have a child with deafness and renal disease. If they mention deafness, it's all with the renal failure is always Alport syndrome. So Alport syndrome, you have a child, you have deafness, you have renal failure, you have cold for A5 gene. So All. So the mnemonic is all. All means there's every type of inheritance. There's X-linked dominant, there's X-linked recessive, there's AD, there's AR, autonomic dominant, autonomic recessive, A for all, A for all part, A for alternating to this. So how is it all? Alternating, thickening, and thickening. Another all is alpha 5, so AL, alpha 5 chain. Call call for A5. Yeah, so there's gonna be back. That's it. That's the only all that are. There's basket view appearance and there's anterior lentic harness. So easy to remember. There's a child with deafness and a child with renal failure. So the diagnosis is output syndrome. So A for all for alpha 5, all for call, all for all inheritance, all for alternating, thickening, and thinning. But remember, even though I say all, it's more common as X-linked dominant. And then you have anterior lentic decotus and basket wave appearance. Next, we have asymptomatic renal tumor. So asymptomatic renal tumor, presence of blood vessels, adipose tissue, and smooth fibrin layers. The smooth fibrin, closer vessel. What is adipose tissue? There's blood vessels. So this is nothing but the angio. It's simple. The answer is in the microscopy. Angio, myolipoma. So it's angiomyolipoma associated with tuberculosis, cardiac mass, rhabdomyoma, hydroceles. Next, we have malarash. Malarash is obviously simple as it is. Oral ulcer, arthritis, photosensitive rash, ANA positive, anti-Smith, most specific, best is anti-DS DNA. Most specific is anti-Smith, Smith for specific. But best diagnostic is D for diagnostic, D for DS DNA. Most sensitive, if yes, it's ANA. Now, there's going to be wire loop lesions. So wire for four letters in wire for class 4 lupus nephritis. Wire loop lesions or class 4 lupus nephritis. There's going to be thumbprint appearance in the electron microscopic. Something like what the fuck, WTF, but does not stand for what the fuck. It stands for wire, thumb, and full Haas effect. So this is the full Haas effect. They mention all like this, all the IgM, IgG, C3, everything is positive. It's full Haas effect seen in SLE, lupus nephritis, type 4 lupus nephritis, or SLE. Now, we have a patient with hematuria and renal mass. So you see there's a lot of, it's simple. Clear cells, there's nothing in it. There's literally nothing in it. It's empty cells, nothing but clear cell carcinoma. And what is clear cell carcinoma associated with? One of my friends has, one of my dear friends, has clear cell carcinoma. She has not clear cell carcinoma, she has VHL. But I keep warning her to take care of her kidneys. Like, you could have a clear cell carcinoma, you could have a medulloblastoma, you can have a glioma. She already had a glioma. She has a lot of kids in her head and her body. Kids as in the tumor cells. Okay, so it's associated with VHL syndrome, and VHL syndrome, you see pheochromocytoma, you see clear cell, you see cerebellar hemangioblastoma, you see retinal angiomas. Most commonly affects the PCTs. Now, hematuria with renal mass. So, you see, this is what they fucking call fried egg appearance or perinuclear clearing. You see, there's nucleus clearing. This is called the perinuclear halo or perinuclear clearing, which is seen in chromophobe renal cell carcinoma, and chromophobe C4 is chromophobe C for collecting duct. Now, next, you see a lot of papillae. This is nothing but papillary RCC, finger-like projection. So P is not P. It's not seen in PCT. We already said PCT, you see clear cell carcinoma. Whereas in papillary RCC, so what's left is DCT. Now, hematuria with renal mass, small dark blue cells. Only. Okay, this reminds me of small cell carcinoma where you have the same thing, small dark blue cells. Well, here, but you're talking about kidneys, not the lungs here. So it's a firewall with hematuria and renal mass. So first thing that most common cause, you just think blindly, you just say Wilms tumor. Wilms tumor is nothing but WT1 gene, where WT2 gene is associated with Beckwith-Wiedemann syndrome. And WT1 gene, 11q chromosome, triphasic tumor, Weiger syndrome, aniridia, Denny Drash, Denny Drash or Denny Crash. We have gonadal dysgenesis and Beckett-Wiedemann, where you have organ anomaly. Most severe is Beckett-Wiedemann. Now we are entering gonadal tumors. So testicular tumors. So gray, white, no hemangioma. We gotta remember semen. Semen is white, so seminoma. Seminoma, you have LDH tumor marker, IHC kit of 3-4, color full kit October 3rd nanogene. So you think of a guy, you think of a male, you think of Nanaji. Nanaji is nothing but why are you gay? What do you mean, dear? Why am I gay? Why are you gay? Oh my god, come on, thank you for the raid. How are you? How was your stream? How was your league stream? I joined, but I think you were on a break or something and then had to go for dinner. This isn't league, I'm confused. It's a study stream. Yeah, I do study sometimes. I'm a doctor. Since I like you, fanboys of mom. And I'm not gay, I'm bisexual. I'm not gay, who said I'm gay? You are gay. So yeah, I do study sometimes, Kuma. And how was your stream? How was your league stream? I did join, but you went somewhere. I think you were on a break or something. I think you went to the washroom. I don't know. Oh no, doctor, my greatest fear is an American. Get a health insurance. I know. It's not the doctor's fault. It's a fucking health system. It's the health system in America is just fucked up. Doesn't that make you 200% gay since you only write cock or fuck people who want to write cock? I think this is the right time to add the buffering on my head. What the fuck? I'm invisible confusion. My brain doesn't brain anymore after reading that. My last game actually tilted me, but I won and claimed top diff when I was 310. Lol. What were you playing and who were you playing against? To go 310. Oh my god. And if my brain is not braining anymore after you so 200% gay. How does that even work? Doesn't that make everyone gay? Doesn't that just make everyone gay? The entire world is gay. I'm sadly frozen to top into picture with being capped like it. Oh my god. That probably is just painful. That probably is just painful. Playing shoot top against a Victor. I mean, maybe it can go well, but yeah, with the jungle cave camping, perma camping top, that just sounds painful. I played a Gwen game today. I was playing Gwen against a Zahen. And I kind of crushed that Zahen, but the Talia jungle, the open Talia jungle kept trying to gank me constantly, and I kept dashing away. Oh my god. He's so slow. I carried that game so hard, and I typed in chat. You would have won if you stopped trying to perma camp top, which failed every fucking time. When he came in, I was actually putting dinner in the oven. I'm making a home cooked dinner today. What are you eating? What are you eating? But you're definitely the gayest of the gays. Oh my god. I am the gay lord. I'm the gay lord. I'm Dr. Gay Lord. Jacket, don't call me that. Don't fucking call me that. What are you making for dinner though, Kuma? How is straight people only 50%? Oh wait, they are 50%. It does not make sense. So straight people fuck people who want cocks, who want dicks. Straight people, so does that makes them gay as well? Dr. Gay Lord Fucker. Oh my god, this is just getting worse. This is just getting worse. I'm making baby back pork ribs with gold mashed. What's baby back pork ribs? It's like a baby pork with golden mashed potatoes mixed with white cheddar cheese and some. Oh my god, that sounds delicious. And corn. That sounds so. I love pork ribs. Pork ribs are like one of my favorite meat. And so there's only one place here that makes really good pork ribs in like city. This brewery. So every time me and my cousin go there, we order beer or what's that? Apple cider. We order an apple cider and we order pork ribs every fucking time. Like every fucking time. And we don't even get bored of it. We just every fucking time. It's like we've been like 3 times, so then all 3 times we had pork ribs. It's just they have the best pork ribs here, I swear. Have you seen Meet the Folkers? Sounds familiar. I feel like I've heard of it. I feel like I've seen it somewhere. I just can't remember. I kind of feel like I heard that Folkers before. The Folkers sounds so familiar. It's an old movie. Ah, yeah. I think I saw somewhere in YouTube. Then I don't think I watched the movie itself, but I know the Folkers thing. Okay, where were we? So yeah, I told it's semi-normal. That's gonna be gray white, no hemorrhage. So you see a white histoplasm testis. There's no hemorrhage. So what's the color of semen? It's white. So semi-normal. And semi-normal men. And you remember a guy? You remember your grandfather? In Hindi, we call grandfathers Nanaji. So the mnemonic is colorful kid, October 3rd, Nanaji. So that's nothing but I had seen my first C kid, Oct 3-4, and Nanaji is Nanajin. Of course, you're talking with Sea Man. The Sea Man, the man of the sea. This was not a mnemonic by me. This was a mnemonic by my pervert professor, who I totally was not going about. Okay, so now we have fried egg appearance. So fried egg appearance in renal, we said it's chromophobe RCC. Whereas if they talk about it in a testicular tumor, it is seminoma. So imagine eggs, semen goes to the egg, so fried egg appearance. That's the only way I can remember this. Lol. Anyway, thank you for the raid. Oh my god, I forgot to shout out. 1 second. Give me a second. Let me shout out. Kami, quick. Me too. My keyboard is all the way. Kami, Kumatami. There we go. Wait, why isn't it working? Wait, am I? What the fuck? Oh, it's the command. What the fuck? My bad. Sorry for pinging you twice. Yeah, the command didn't work. The command didn't work. Okay, there you go. Now it did. Did you hear about the cure for cancer? There is cure for cancer. It's called surgery and radiotherapy and chemotherapy. Guess life. Yes. That's a better cure, and what is that? I swear. What? Please don't tell. Wait. I feel like you're gonna say something really sus. I feel like you're gonna say something really sus. The level of trust in my chat. Okay, painful 24-year-old male or female, male of course, is a testicular tumor. Oh my god. With painful testicular tumor. So you see white, you see white, you see hemorrhage, you see both white and hemorrhage. that means there's glandular formation. That's embryonal carcinoma. So, so you see this. You see the microscopy with a lot of glands. We've seen way too many glandular images now, so we should be figuring out what are glands and what are not. So yeah, welcome back from the ads, guys. What is the fucking cure you were talking about? So I had CCD30 positive. Now 25-year-old male with increased beta HCG. There's no white at all. There's no semen. There's only hemorrhage. There's only hemorrhage and necrosis, and that is, my guys, that is choriocarcinoma. Choriocarcinoma, C for choriocarcinoma, C for cannonball mets. One of the most dangerous testicular tumors out there. So multiple mets, cannonball mets. Next, we have multinucleated cells in cytotrophal blast, causing increased beta HCG. Now we have a 10-year-old, a child with testicular tumor. In child, most common is yolk sac tumor. In yolk sac tumor, you see Schiller tumor. Oh my god, that's a big fucking. So scientists for Japan had a theory: if you inject tumor cells with bacteria, then it would help the body identify the cells as threat. And the only one they tried was a bacteria from the stomach of a tree frog that thrives in the low blah blah blah. So they just said that rats, and after being injected, 100% of rats were cured. And after being injected, that is actually bad, guys. That it can, it can actually backfire. So what's the point of injecting tumor cells? It's not with the bacteria, when unless the tumor cells take up. So this is actually not exactly how we said it is. So what we call this is phage. It's bacteriophages. So bacteriophage, it's not exactly a bacteria, you say. It's a DNA. It's a DNA of the virus in the bacteria. You inject. That's actually a thing that is done in a lot of treatment in current medicine, where you inject the bacteriophage. You're basically injecting the bacteriophage in your body, replicating your tumor cells with the bacteriophage. And that's literally most how your, what do you call them? A lot of genetic therapies and stuff are literally out of that, like biological treatments and stuff. They use bacteriophages, and yeah. I know people you can use cancer, but it's really hard, because your tumor cells have to pick up the bacteriophage, and then they have to replicate with the bacteriophage. And it's not 100% cure. It's not 100% cure. There will still be traces of the cancer cells left. So the best is still surgery. You just pull out the tumor. And again, grade 4, you can't really treat even with bacteriophage. It's really dangerous. On humans, treating a grade 4 tumor with stage 4 tumor with bacteriophage, I don't think it's likely the patient will survive anyways. They don't survive. You can't even do surgery. You can only do prenatal treatment on stage 4 cancers. And the best treatment for stage 1 and 2 is, of course, it's surgery and radiotherapy and chemo. So you don't really die with that. And surgery is best. Even over a bacteriophage, I think surgery is the best. It's not that, I can say it. It's pretty much phage. It's phage. In medical, we call it phage. They probably simplified it, saying bacteria, but it's a phage. We have our own research on those. We have an entire chapter on it. Phage replication. Okay. Testicular tumor in children, most common in yolk sac tumor. You have Schiller durable bodies, and this. I just pray I don't get this picture in my exam. I'm definitely gonna fuck it up. I can't remember. This is the one tumor that I can't remember. This is the one fucking tumor that I can't remember the picture. I DMB link. I'll look into it later, I guess. Thank you for the link, Nia. Okay, now we have testicular tumor precocious puberty. So there's a precocious puberty. Precocious, how we remember, I say it's lady. Lady precautious. Lady precautious. Lady tumor. Presence of increased testosterone androgens, wrinkles, crystalloids. Now we are done. Wait, we're not done with male yet. So teratoma, you'll have multiple. You'll have hair, teeth. You see hair, teeth, and different organs inside your testis. It's 2 minutes down. I'll look into it later. I don't want to get copyright strike on YouTube. If I were only streaming on Twitch, that's not have been an issue. Now we have a 5-year-old testicular tumor with a tennis. How does that look like a tennis racket appearance? I swear to fucking God. So it's alveolar rhabdomyosarcoma, presence of desmin. So tennis racket appearance. R for racket, tennis racket. R for rhabdomyosarcoma. So okay, this looks like a fucking tennis racket. Look at this tennis racket. So that's the electron microscope, Burbeck granules, LCH, IHC, CD19, CD207, and S100. I'm not going to remember this. Now we're done with testicles. We are going to ovaries. Of course, you want to focus on studying testicles. What do you mean? This is part of my chapter. This is part of the chapter. We finished heart, we finished lungs, we finished GIT. Now we finished kidneys. Now we are the genitals. And then after this is CNS, and then no, okay, CNS and thyroid, and we are done. Okay, we're not done basically. We still have 100 pages of. We still have general part, which is 70 pages. We're gonna do it tomorrow. Today we did like 40 pages or something. I mean, general path is pretty easy to finish. It's really small. It's like just flowcharts and shit. The most painful one is rare is this. It's fucking this. It's hematology. It's fucking hematology. There's so much to remember in hematology. So that itself is gonna take the entire afternoon tomorrow, I swear. So our plan for tomorrow morning, we're gonna finish general path really quickly, and then we're gonna move to hematology, and we're gonna really focus down on hematology. Okay, now we're going to ovaries. So ovarian biopsy with increased inhibin levels, inhibin, E, exner bodies, called exner bodies you see in GCT, granular cell tumor, or coffee bean nucleus. C for called exner, E for exner, E for increased inhibin levels. That's how you remember inhibin levels. And when you say called exner bodies, it has to be granular cell tumor. So you C for called exner, C for coffee bean nuclei. Another C, remember, is CD99. CD99 in bone is E. Another E-wing sarcoma in bone. Now, where were we? Wait, that's it? Just granular cell tumor? We already talked about teratoma. I'm not really happy with this. There's so many more. I think we're gonna read this in gynecology. Now, breast lump, you have a clear mass. I said, remember clear cell carcinoma? So mucinous carcinoma. So there's gonna be mucin infiltration. Even in salivary glands, it's mucoepidermal carcinoma. Now, Indian file pattern or lobular breast cancer. So it's gonna be Indian file as in, see, it's in a straight line. It's like there are a bunch of round bodies in a straight line. So there's nothing but Indian file pattern. Nucleus is an Indian file pattern. So it's lobular breast cancer. So when you say India, you remember SBI, State Bank of India. So how do you remember it? How is it even related to this? Because S is signet cells, B is bilateral breast cancer, I is Indian file pattern, so lobular breast cancer. SBI is signet, bilateral, Indian file. State Bank of India. I is India, Indian file. Okay. If you see signet cell in the stomach, it is diffuse gastric cancer, and in ovaries, it's Kirkenberg tumor. Now, molecular classification, you have luminal A, B, C, D. A is ER positive and HER2 negative. B is ER positive, HER2 positive. It's called triple positive. ER, PR. Why did I say BR? It's PR. What the hell? Oops. Okay. I don't know why I typed PR this. So you're saying the State Bank of India is cancer? It's breast cancer. State Bank of India is breast cancers. But apparently, State Bank of India is not really safe. Someone lost 50 lakhs rupees from their bank, which like I don't know. So apparently, it's like some 10 to 20 years they opened it, and the 50 lakhs was missing. But I mean, pretty much every bank in India is the same now. I don't think you should really trust in Indian banks at this point. HDFC, they sell your account, they sell your personal details to Bihar, and then you get shit on scam calls. Yeah, I wouldn't trust anything. DBS is actually good. Singapore Bank is good. DBS is one of the well-trusted companies. I saw my friends, one of my friends' dad used to work in Singapore DBS. They're actually citizens of Singapore. He came to India for his studies. American Express is really good, but damn expensive. You can't really. I don't want to pay for an American Express card. Holy, that's expensive. So I think comparatively, in India, SBI is the most trusted. I can't trust HDFC at all. Axis Bank, HDFC, I can't really trust. Well, it's not shocking dealing with Indian companies would get you scam calls. Yeah, HDFC, I remember there was that part where, that year when they sold personal details to, I don't think they sold on purpose, but some sort of a hacking. So, yeah, and then scammers, cyber fraud, they kept calling people and saying they're from some CIA or something and saying that they're caught for cybercrime and they have transferred like 50,000, 1 lakh. One guy lost 3 crores or something apparently over phone. You can just get the bank. Well, in here you can just get the bank app on your phone and use your phone as a payment card and do it for free. Yeah, we do have that here. We actually do have that. But I don't know how far you can trust. Hey, where's Kumi? I fell asleep in a stream and that's okay. There's a femboy now. I follow. Thank you for the follow. Lamal, hi, welcome to the stream. Kumi. Kuma finished his stream and he's gone now. He went to eat his dinner. He went to eat his pork ribs. Thank you for the follow, Azriel. Welcome to the stream. I hope you enjoy it. We are doing a study stream and yeah, it's gonna make you really sleepy, I guess. So yeah, we have something on UPI. We have something similar to a payment card. We have UPI. But again, UPI, I don't know how far you can trust it. Lose your phone and it can be easily hacked. Okay, now where were we? Luminal A is ER/PR positive, HER2 negative. Luminal B is ER/PR positive, HER2 positive, which is nothing but triple positive. So luminal C is ER/PR negative, HER2 positive, and luminal D is triple negative. So higher the Ki67, better is the prognosis. It's not written here, but I do know that. Young female with mobile breast lump. So mobile breast, not mouse breast. It's nothing but fibroadenoma. Next, we have elderly female with benign breast lump. Elderly female is nothing but Pillows tumor. Pillows tumor is nothing but like. Well, with the bank app, there's an option to have the phone unlocked in order to make payments. Yeah, I remember Samsung Pay has that one, the one tap option where you don't even have to type in the passcode. And imagine you lose your phone and you're just fucked. They can just use your payments. Your mom had breast cancer. I'm so sorry. How is she doing? I hope she's okay now. Okay, we're done with breast cancer now. I think we covered breast cancer and surgery already. Like pretty much done most of it. I would never do that. Yeah, even I never did that. I always make sure I have to type in like 1 or 2 passcodes. There's also some payment cards like that where you can just tap the card and you don't need a PIN. Yeah, I have those. I have this, the NFC cards. I mean, it's convenient, but I set a limit so that you can't tap per day more than that. And if I lose my card, I'd know. I'd know by then. So they wouldn't have tapped much because there's this really small limit I put. Only for emergencies. I use it only for emergencies. No, she's fine. She did some chemo radiation and they cut half her boob out. Oh, okay. Yeah. I think it's a breast conservation therapy, right? Yeah, you have to cut out the tumor portion and you can put a silicone later. You can use there's something called a breast reconstruction surgery where we use a flap, muscle flap, usually a latissimus dorsi flap, to recreate the breast tissue. Okay, now we have a 32-year-old with tinnitus, there's nothing but ringing in your ears, and CP angle tumor. So you say CP angle tumor, tinnitus, probably associated with schwannoma. Schwannoma is Antony A, Antony B. Antony A is hypercellular, Antony B is hypocellular. Antony A, you reverse the A, you're going to get a V. So the presence of verrucate bodies or true palisading. So true palisading is present in basal cell carcinoma and schwannoma. S for schwannoma, S for S100, and NF2. No, she kept it like it was. It's a reminder she fought under that. That's good. That's good. Really big hats off to people who survive cancer. Cancer is really dangerous, but I think now with newer modalities and earlier screening, I think incidence of breast cancer is significantly reduced. People still ignore it, but now it's made compulsory to get it screened. I don't know how compulsion it is to get it screened abroad, but in India it's pretty compulsory by the government. DMT is something that might help you learn about testicles. Oh no. Oh no. Is it something what I'm thinking? I can't open my Discord right now because I closed Discord on my PC. I'm using my tab as a second screen and I'm using my phone as a webcam. I don't have access to Discord. Yeah, that's why I said I'll look into whatever you sent later because I can't access Discord right now. And I have to open. But so basically, how my setup is right now with the webcam, because I'm not going to use my PC much, I put the webcam right in on my from my PC, so it's like blocking the PC. I can't really use the PC. And then there's my second screen, which is my tab, which I'm using as the second screen, where I just dragged all the tabs which I need, like the chat, Twitch, and YouTube chat, into the second screen. I'm a type 2 diabetic, not on insulin, I'm taking pills. Oh, you're taking OHAs? Okay. I hope you really control it. You need to be careful, not of hyperglycemia, but you should be careful of hypoglycemia because hypoglycemia is more dangerous among diabetics. Oh, thank God. It gives me PTSD because something bad happened last year regarding, insulin-related episode for me. But you're taking glipizide, okay. That's good. Glipizide, it does cause hypoglycemia. You need to be careful. Yeah, I mean, metformin does this. Metformin is rather safe. But metformin, since your mom already had breast cancer, I wouldn't really suggest metformin. I don't know, there's some studies regarding metformin and estrogen related. I don't remember what was it on. I don't remember. It's just something that's just slipping into my head. I heard you could potentially get rid of diabetes through straight dieting and exercise and getting in shape. Actually, so people say take meds. It's safe to take meds, but I've heard of stories as well, and I've seen people who. So basically, the first goal of diabetes before we even recommend meds is lifestyle modification. You have to control your diet. You have to get into shape. You have to control your blood glucose. And if it's not controlled by that, then we suggest medicines. But so I've heard of people who are on medicines who do follow regular good diet, good exercise, and eventually they lose. Eventually they stop taking medicines as well, and they're completely fine. No, mine's always high. The highest I saw the glucometer said seek immediate medical attention. I took the nap. He took a nap and was fine later. What the fuck? But yeah, I'm always afraid of diabetic patients. It can go worse if you don't eat or if you even eat. Yeah, that's called gestational diabetes mellitus, and it usually resolves after pregnancy. But sometimes it remains, causing chronic diabetes. So there's one thing about pregnancy. Pregnancy, it's a high, it's a high consumption state. Basically, your body needs everything in more quantity, and sometimes it causes gestational diabetes or diabetes in pregnancy. Sometimes we got hypertension in pregnancy, increase in BP. It causes a lot of heart disease, but all of this lasts only in pregnancy. And once your body is out of that stressful state, your body just goes back to normal. That's pretty much how it is. But sometimes your body is unable to cope up with it. It just continues on, causing chronic morbidity, like chronic diabetes, chronic hypertension. But yeah, back to diabetes. I deal with a lot of patients who were on deathbed on both the ends of like worst case of diabetes. One is hypoglycemia, one is hyperglycemia. Hyperglycemia, they're diabetic ketoacidosis, which is both are really scary. Both can cause you to go into coma. But one thing you're always scared about diabetes in a patient with diabetes is hypoglycemia, because they take insulin, they take their meds, they don't eat properly, and next day morning they don't wake up. They just go into a sort of coma. They go into hypoglycemic shock. I can try to say 5K so I can ban and oh my god, that was the thing. Oh my god, I should increase the points. I completely forgot about channel points. Oh my god. Okay. Yeah, fine. Yeah. Yeah, there's some restrictions on that. You can ban certain stuff, but you can't ban everything. You can't ban important, like left clicks are essential. And the in-game ban action is only for 5 minutes. Now I have to survive for 5 minutes and we're good. I think the worst one is removing my glasses because I can't see anything. Then, even worse than banning in-game action is removing the glasses. I have to literally squint. I have to stick my face to the monitor just to try to play. Yeah, really high sight. I'm gonna get elastic done this year. No, I'm banning aiming. What do you mean aiming? What do you mean aiming? What aiming? I only play League of Legends. What aiming do you have with League of Legends? Spin the wheel NSFW. Yeah, guys, do not look at the channel points. I need to change a few things. We still haven't made a spin the wheel, by the way. I thought we will make it when someone claims to spin the wheel. So yeah, we have to make a spin the wheel. You have to add stuff to it. It was sort of a trend back then. I think half a year ago, when me and my friends, other streamers, we had this spin the wheel thing, and in this stream we always used to save up till we get the spin the wheel. So yeah, I pretty much copied it from him. But I think no one here ever reached spin the wheel, so I never bothered to make it. We didn't have a spin the wheel. I just lost it. I think I lost it. It's been half a year. I pretty much lost it. But yeah, it needs to be updated. We need to add stuff to it, remove stuff. Yeah. Okay, where were we? We were in the brain. But what would the NSFW version be? I thought that was up to you guys. I thought we can make some. We can make some good NSFW. We spin the wheel. I don't think we have an NSFW spin the wheel yet. people could just discuss and chat about it, or in the server, or in the Discord server, just make a thread or something. We should make a thread. Yeah, I will do all that. You guys can do it if you. I think threads, even anyone can make threads. It's not a big problem, but I need to fix the Discord server. I need to fix a lot of things on Discord and Twitch both. Like some of the emotes are too small. Some of the emotes are way too small, like the ones from the emote lab. Hentai Ravi spin the wheel. Actually, I remember making one, adding one thing called Yuri and Yaoi, like each separate. Yuri reading in the stream. We could do one voice acting of a hentai manga. Of course, I'm not going to show the hentai manga on stream. That would be NSFW, but we could do an ASMR voice acting. It would be funny. It would be so funny. Where we keywords: farmer with the skin biopsy, nodular palisading, basal cell carcinoma. Surely discussed. Now we have a bone tumor, a 10-year-old with a bone tumor, and they say something called Codman triangle. Codman triangle is seen in osteosarcoma, which is a bone-forming tumor. Does not pick osteoids. Well, there's NSFW in the dating name. I mean, not too NSFW. I just put it NSFW because I wanted one 18 plus reveal and 18 minus. Not too NSFW, not something that's gonna reveal nudity in the stream. I would get banned for that, no? I'm afraid of opening Twitter sometimes just because of that. I don't know, there's some random NSFW stuff that comes up somehow. And that happens only when I stream. That happens only when I open it on stream. Okay, where were we? So, again, Codman triangle. What are the other causes of Codman triangle? You can see Ewing sarcoma, which is translocation of 1122. Presence of pseudo-rosettes or homoryte rosettes. Homoryte rosettes are seen in medulloblastoma, Ewing sarcoma, and neuroblastoma, or what we call men in children. That child is a man. He's a man. Medulloblastoma, Ewing sarcoma, and neuroblastoma. That's where you see pseudo-right or homoryte rosettes. Now you have a child with orbital tumor, where you have true rosettes, which is nothing but flexural Winter-Senior rosette, which is retinoblastoma. RBG mutation, most common extraocular cancer is osteocyst associated though. Join the Discord. I'm going to go verify my phone after the stream. Okay, thank you for joining. Oh crap, 15% left in my tab, which I'm using as a second screen. Man and children. Sounds like the name of the event on Epstein Island. Oh my god. Guys, what the fuck? What the fuck? We don't talk about Jeffrey Epstein in this chat, okay? Wait. That just sounds so romantic. I'm gonna take it back. I meant the personality of a man and a child. Like, you know, how they say mature children. That's what I meant. Man and child. But yeah, it can be taken sexually, and that just sounds so fucking wrong. Oh my god. I need to reframe it. Holy Epstein. I remember seeing that one meme in Instagram. What was that? GTA 6 Epstein Island or something? It was a weird Epstein related game, like a game meme. Some guy goes to sell his game in a GameStop, and it said something related to Epstein Island. Okay, where were we? Bone tumor. I can't see anything. So apparently there's giant cell tumor of the bone, which is a typical osteoblastoma. These are mononuclear giant cells. Now, next we have a cerebellar mass with pink rod-shaped inclusions. Pink rod-shaped inclusions are Rosenthal fibers. Rosenthal fibers is the pilocytic tumor of astrocytoma. BRAF mutation, WHO grade 1 slow growing tumor. Next, we have a frontal lobe mass with serpentine necrosis and pseudopallisating. This is nothing but glioblastoma. And then we have a butterfly tumor. Okay, well, at least you're not as clueless as people who made the chord points taken. What? Chicken wire capillaries, fried egg appearance, another fried egg appearance in brain. This is what it's saying. There's something in brain which is related to fried egg. Oligodendroglioma. O for O. O is for circle. Circle fried egg. Oligodendroglioma. 1p19q correlation. Odd points. My God. Give me a second, guys. Is something I'm supposed to be using on an incognito? I don't trust you guys. I don't trust you guys when you ask me to Google something. So I get Call of Duty Store India. I don't know, just chord points. I just my fat fingers, fuck. Picture of the booty in shorts. What the fuck? I just saw a picture of the booty. Ah. Images. Guys, there's nothing. There's just coins with CP written on it. What the fuck is CP? Hard points? Does it mean something else? There's just images of coins with CP written on it. You don't want to know? Why did I even search that? It doesn't? Wow. What the fuck? Chord points, it means chord points. Okay. Oh my God. I'm just curious. So oligodendroglioma, you see fried egg appearance. O for oligo, O for circle, you see fried egg. And what reminds you of egg? It reminds you of chicken wire capillaries. Sure. This is kind of getting fussy. Oh wait. Oh, never mind. Now it clicks. No, I fucking understood. Is it something related with children? I hate you guys. I fucking hate you. I'm joking, but Jesus. Ependymoma, periventricular erosis, blood vessel incentive. No way I'm gonna remember that. 40-year-old female tumor in falls. So there's some of my bodies, which is seen in meningioma. Okay, I hate this part of the. I hate the last 2 pages. I hate these last 3 pages. Never get them. Okay, I'm fine with this. Page. I love thyroid. I love the thyroid. I hate this 1 page. This 2 pages. I hate this paper. Sorry for that. I hope it didn't hit your head. Ears too loud. I actually hit the mic. Okay, so PTC or nuclear, some of my bodies, papillae, prognosis good, palpable cervical lymph node, MTC, red gene, we already said neuroendocrine tumors, follicular thyroid cancer. I hate this fucking topic because I lost gold medal because of this one question. It was not my fault. It was just different in different books, and the professor refused to accept it. So there's no head pads for the channel points. I'm actually gonna add it after my exam. I have TITS, not the TITS thing, but I have the throwable, which integrated throwable system where you can also use head pads for it. So I need to set it up. It's a little complicated. I really need help, but not many people know how to set up tits. Twitch integrated joint system. That sounds so wrong when I say I need to set up tits. So yeah, if I can set that up, then we can have a lot of more new channel redeems. It's gonna be more fun, but I just don't have the time because of my fucking exam in less than 20 days. Okay. Okay, I'm done with chat. Let's play some League. Let's play an ARAM game before we go to sleep. 1 second. Let me just remove all the shit. Let me just remove all the shit. I also finally fixed the overheating issue on my phone when I use it as a webcam. So how I did it is I made the webcam app recognize as a game. So what my phone does is when I play a game and on charging, it does not use the battery. It overrides the battery so that the phone doesn't get overheated. It's a really smart update. I love this up. I love that update. Quick question, how tall are you? I'm 6 feet. I'm 183 centimeters tall. 6 feet. But my community refuses to believe that I'm 6 feet. And I don't know how to prove it without doxing myself. Well, let me open League real quick. 1 second. What about watching the video I sent you? Yeah, I told you I can't do it if I'm streaming on YouTube. So if I'm not streaming on YouTube, I would have definitely done it before. But now that I'm streaming on YouTube for my YouTube partnership, I can't stream videos. You're 3 inches shorter than me. How tall are you? Okay, I'm opening League. .6'3". Whoa, that's really tall. That's really tall. Just stream on Kick and Twitch instead. I don't really support Kick because they have that gambling. It's really the gambling because the certain people who own Kick also support that gambling thing, whatever that is. So I don't really want to get into something that might crash anytime soon. I don't know. It's just hard to trust the platform itself. And I heard that a lot of bots on Kick as well. So, plus, I really need YouTube partner. I want to get health partner on YouTube. And that would be really big for me even in the future. Because then I can, once I join a specialty, I can just use YouTube partner to promote health stuff. .9 meters. Oh, are you a basketball player? Please tell me you're a basketball player. Yeah, Kick is not since Gamba. Twitch also has a slots category, and also I heard Kick is better payment. Yeah, Kick does have better payment for you. I heard that, but Kick is filled at boss, which it's pain in the ass, and Twitch is more stable than Kick because you're not gonna have a day when suddenly Twitch is just gonna crash itself. But people are afraid. Every streamer is actually afraid that Kick someday might just, just lose everything all of a sudden. It's sort of a scary situation. So not many people want to do that high risk, high reward thing, and that I'm including one of those. That's why you dual stream. I'm dual streaming on YouTube and Twitch. And I have to stream on YouTube because I want health partner. And more than this, my PC won't overtake KICK. stream on all three. I fucking can't stream on two for very long. I don't know. I need the new PC, honestly. 3060 is dying. 3060 is so dead. This is barely gonna survive if I do 3 streams at once. Though I really wish I had TikTok or something. I would have triple streamed on TikTok otherwise. But TikTok's banned in India, so pain in the ass. I was actually I would have just not done YouTube. I would have just done on TikTok. Let's go, Brian. I have had a 1070 Ti for like 5 years and still works fine. That's crazy. I have so many FPS drops. I don't know why. Even playing League, I have FPS drops when I'm streaming. I don't know what's wrong with it. I don't know if it's just Riot being Riot. Because as a VTuber, I have so many apps opened for the stream. I feel like my laptop just can't handle it anymore. It just can't handle it. It's a Legion. It's a fucking Legion Pro, but it just can't handle so many windows at once, you know? That's why I try to avoid AAA games, streaming AAA games as well. Okay. The gain the shield after immobilizing, or wait, isn't this much better? Actually, that was much better. Let's just roll this. What the fuck is this? If a target knocked by a chilling scream hits another champion, they are colliding with the terrain. What? Wait. Oh, wait. Fuck. Never mind. Never mind. I thought I was playing Victor for a second. I thought I was playing Victor. I thought I had Victor. What the fuck? Like, what's happening, team? Do I just go Borg or something? Would I go? Do I go something like Lethality? Let's go Lethality. Let's go Collector. Trait Lethality, yeah, exactly what I was thinking. I need that Infinity Edge upgrade. Holy sick, look at the FPS drops. What the fuck is this guy doing here? Look at the fucking FPS drops. Oh crap. You kinda need the shield from Eclipse. Sure. Crap, I'm dead. Ah! I shouldn't have flashed. Shouldn't have flashed. Holy, what the fuck is that shield? Disgusting. Look at that fucking shield. Wait, what the hell? Okay. Nice. What the fuck is that shield? I don't think I need Eclipse shield anymore. Look at that shield I get from the augment. That's genuinely disgusting. That's so disgusting. And it scales. That shield, by the way, scales. What augment you take? You get shield on immobilizing an enemy so that it works on both my Q and my E. Look at that shield. Look at that shield. Wow. So I can just get a fat shield. Oh, the FPS drops are killing me though. Go. Shit, I'm dead. Am I finally dead? No, I'm still alive. What the fuck? I'm still alive. And the shield when you ult in, it's the same. My shield fears them, so it's still sort of immobilization. So kind of disgusting, no? Look at this. Look at this. What the fuck is that? What the fuck is that? No, man, I'm dead now. Finally, you're dead. It's so disgusting. That shield is so disgusting. Electors. Max E second. Yeah, I'll do that. I'll do that. I remember the days when we used to go AP Briar. Still can if I get good AP augments. Fuck. Wait, what? Wait, where did the Twitch go? He disappeared all of a sudden. Oh, he's there. Back. I just want to jump onto the Twitch. Yahoo! What that fucking shield? That shield is so disgusting. Nice. Aye. I think I'm dead. I think I'm dead. Oh, I got the kill. I snowballed him in the end. I snowballed him before dying. Wait, is this good? I don't know. Oh, Hellbent. Hold up. No, Hellbent is not bad. Wait, Hellbent is still good, right? On hit reduces the cooldown of your abilities by 1.25. Chatta. We're cooking. Do we just go IV now? Do we just go IE? Permanent W. I know, right? Permanent Qs and Ws is gonna be crazy. Ooh la la. Fuck. Knocked him down. Law. Jump on. It's permanently CC'd. Okay, bye-bye. I'm dead. Oh my god, but he was permanently CC'd. They couldn't cure anyone. Wait, what do I go down? Do I need to go like on head? Do I need to... Or do I just go crit? Do I just go crit? You know, this is going Infinity Edge. It's too late. Oh my god, this is disgusting. This is just disgusting. I could have gone Boric, honestly. But eh. Shit, I think I'm dead. Yeah, I'm dead. Yeah, we kind of inting. Yeah, kind of inting. We're inting a little. Okay, what do we go third item though? We need, come on guys, cook. We need to cook. What do we go third item? Booklet which cap on sale now, what the fuck? Nah, boots, I don't call that boots as an item. Next. I don't give a fuck up that boots in era. Shit. Am I dead? Oh, that's so bad. That was just so bad. That was so bad. Why did I aim alt tab the E? Of course, it's gonna cure all of it. And worst part, I pressed the alt after he cured, thinking that I kind of misjudged his cure time. Armor penetrate item. Sure. The one with the attack speed, right? The one with the, what's it called again? LDR? LDR. Yeah. Or I could just go Berserker Grease. Why not go Berserker Grease or some Omnivamp related crap? Fuck you. Shit. I'm dead. Wait, I'm alive. Can I run? Can I just run? Whee! So much healing. Oh my god. Healing on top of that, we get so much shielding as well. Oh, Foggy's dead. Lol. I'm dead. I thought I'd get the shield from the ult, but my ult didn't proc. We're on the road. We're on the fucking road. Night stalking. Oh my god. We're on a fucking road. Oh yeah, everyone's 80. I think yeah, we just got played at certain cups. We are on a fucking roll. Night stalking on Brad is disgusting. So basically a kill. I have time to reset onto latch onto someone else. Oh come on, you fucking that was such a horrible Bardal. Why did he drop the Bardal? They would have died to me. Okay. Dinara got the penta, but that could have been fucking me. Guys? Nope. Oh, can I turn the Kogwa? Hold up. Murdered? Lol. Wait, I'm dead. Got feared. Got feared. Got the Kogma and the Twitch, that's so worth it. Really worth it. Holy, I just love playing Briar on ARAM. I like playing Briar in general. I play Briar normal jungle sometimes. I did play Briar in gold when I was climbing once. I think it was in silver. It was such a stupid climb. Some people are really bad at countering Briar. This part kind of sucks with this ult. Just waiting for the right time. I know there's a Yi over here. Never mind, he's not here. Pussy. Pussies. So all I need to do is ult the Twitch. Nope. Missed. Whoa. What the fuck? What the fuck? I think I'm dead. Yeah, I'm dead. Gain increased speed towards low health enemies. Yeah. Or your attack should have myself. No, increase speed, increase speed, increase speed. We gotta go fast. And we almost have LDR now. What the hell? DE has 21 kills. What the fuck? He didn't get a penta, right? I don't think he ever got a penta. What the hell? What's a Kog'Maw doing here? Yippee! Let's go! Ulala. Now how do I get out of this situation? Okay, never mind. Well, I think I'm dead. Yeah, I'm dead. That he does so much damage. Oh, wait, how did he die? Oh, wait, how did he die? What the fuck? What even killed him? I'm sorry, what? Brian has, after a hit, damage or something like nothing? No, right? I think we'll go Death Stance now, or do we want more crit? Shut up. Next one. What do we go? Kragans? Or we go Borg? Honestly, we go Borg. It's not too late to go Borg. We just drop our ult. I'd say Borg is still good here because of Mystic Punch. I'm coming! I can't reach on time! Oh, got him. Got him. Ow, I got feared. Hold it. Hold my beer. Yippee! Oh my gosh, that was the KS. Holy bitch, we are like insanely fed, I swear. Chatamate, where is the rat running? Where is the rat running? Where do you go? I see that. Bye bye. That was so stupid. That was so stupid. Oh my god, that Kog'Maw instantly murdered me. What the fuck? I have no idea what to do now. I feel like we should go something with attack speed-ish. It's like Rage Blade. Hold up. Now. Now worries. Hold up. Now worry. Now worry is not bad. Now worry is not bad. I remember we used to get Nauri Krakens on the Champ. Oh. Yeah, I ain't gonna hit anyone. Guys, ads start in 30 seconds. And? Where are you ending? I gave you permission to end. Yeah, but... Yay! Okay, never mind. I think it's GG. Pretty much GG. I killed the only ones who could have probably deleted that wave. I can't blame my team. They fucking killed the turrets for it. I was just scaling. I was so scaling. I just needed one more item and then we could have gone shit ton of hats. Where did I get to the hats phase? Those are sad. Okay, I think one more game and I'm done. One more game and I'm done. What today? 56k damage. What's this? What did I get? What did I get? Did I get a chest? Nope. Oh, I'm already done with those. Shit. Oh, wait, I do have Discord open. What the fuck? Of course, you had to send that Shift Dragon. Of course, you had to send that Jamil. Frog cures cancer. I looked at it later. Let's go now. Yeah, I thought I usually close Discord. I thought I did. Like I said, I missed it this time. Morgana. Holy shit, I'm so tired today. I feel so exhausted, even though I slept a lot today. I slept around, let's see, I slept yesterday at 2 p.m., 2 a.m. till 2:30 a.m. Look at that. 7 hours. Then I slept again till I slept almost 9 to 10 hours today. What the fuck? That also I'm uploading like 1 to 2 clips every day from my streams onto YouTube and Instagram, so make sure to check it out. Because okay, that's taking a while. That's taking a lot of time. What the fuck? Okay, we're playing Morgana. Ooh, hold it. Oh no, ability hits on my Q. Hell yeah. This is gonna be fun. This is gonna be so fun. This is gonna be so fucking fun. Where's my team? Why is he so far back? What the fuck? Wait, they didn't even come yet. I don't know what they're doing. Okay. Boom. Permanently stuck. How did that connect? What the hell? Owie. I have no mana. Wait, I have mana. But I feel like I'm gonna miss it. He is walking all over my W and it barely does any damage. Wow, that hit. That's somehow hit. Yep. It. Nice. I don't know how it hit, but cool. No, 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 no. Don't FF an ARAM game. Oh, fuck. They FF'd an ARAM game. No. I feel like if I start another game now, it's just gonna be too late. So I think we're just gonna call it a day. And we have a double stream tomorrow. We are doing a study stream in the morning and afternoon, and then we're gonna stream League at night. So yeah. Anyway, thank you guys so much for joining my stream today. Thank you, Kami, for the raid. Love you guys so much. Bye bye. Thank you so much for the follows as well. See you guys on. See you guys tomorrow. Yeah, see you guys tomorrow. In about a few hours. In a few hours. Bye bye. Talk to you in blocking off.